Good morning. My name is Kathy Nowak, and I'm the interim co-chair along with Gail Potter. First off, I'd like to thank the people who were attending, our members of the committee, and the locations in Buffalo, People Inc. Thank you for lending us your space. And thank you to Center for Family Support for lending your space as well. So we're going to do an attendance, and I'm going to call each name. And just in Albany, please raise your hand. And in the other locations, just as long as you're all in attendance, just say we're here. In Albany, we have Jan Fitzgerald, Sunmount, Region 2. Maria Suchi Kozak, Hudson Valley, Region 3. We have Ann Scherr, Western New York, Region 1. Tina Vale, Bronx, Region 4. Mary McGuire Weaver, Manhattan, Region 4. In Buffalo, we have Karen Actionfair, Region 1, Finger Lakes.
Here.
Thank you. In New York City, we have Mary Fasano, Long Island, Region 5, and Deborah Bright, Brooklyn, Region 4.
We're here. Thank you.
Thank you. And virtual, we may have Crystal Bassler from Western, Region 1. She had an emergency this morning, so she may not be in attendance. We have Chris Palega, Region Lakes, Monroe. Finger Lakes, Monroe, Region 1. And Margaret Raymond, Central New York, Eastern, Region 2.
I'm here.
Okay.
Yeah, Hussein, please, I'm here.
So we also. Aliyah Hussein is virtual. We also would like to let you know that Mary Fasano will be our timekeeper. So if we go on too long, Mary will make us aware of that. And Mary McGuire will also be our point person. If you want to ask a question, Mary is going to be keeping track of who's first, who's second, so on. Next, I'd like the OPWDC staff who's in attendance to introduce yourself.
Good morning, everybody. My name is Alexis Harrington, Associate Commissioner for Service Access and Program Implementation. I'll take it over to Chad.
Hi, good morning. I'm Chad Colarusso, Director of Family Sports for OPWD. Pass it to me.
Morning, Nick Hobson, that's statewide coordinator. Thank you. Give me a chance to introduce yourself.
Oh, hi, I'm Amy Burdick. I'm the Assistant Statewide Coordinator for FSS.
And I'm Eileen Haynes, General Counsel. Morning, everyone. Carrie Nagel, Commissioner. Virtual world of OPWD. We've got Anne Marie Peterson on.
Hello, everybody. Anne Marie Peterson, Associate Commissioner, work along with Alexa.
Good morning, and Christine Carey.
Good morning. Hi, I'm Christine Carey. I'm the Associate Commissioner in the Division of Fiscal Policy and Management.
Good morning, and we have Deb Ellis.
Hi, Deb Ellis. I am the Senior Advisor for OPWD Operations.
I can add. And we have Josh Olson.
Hey, good morning. I'm Josh Olson. I'm the Deputy General Counsel.
All right, I think that's everybody from OPWD.
Thank you.
Could we do next slide, please? Absolutely.
We wanted to take a moment to review our agenda for the day. Please note that some of the times that are listed will be slightly different as we've modified our schedule. We'll start out with priority areas. After some opening remarks, we'll have some priority areas and updates from our subcommittees, including bylaws, the RFP subcommittee, advocacy, the FSS ADM, and stakeholder engagement. And then we will have a short break. When we return, we will have a brief review of the travel policy updates and some program updates and information, as well as meeting follow-up, some provider feedback and updates. Also, we'll be hearing from the commissioner right after the break. And we will also end with public comment. Okay, I'd like to introduce Mary Fasano to talk about the work of the bylaws committee.
Good morning. I'm just a little bit confused. I see Aaliyah there, but I see she didn't acknowledge that she's on.
Yes, she did.
All right. Okay, bylaws. As you know, at our last meeting, we, as a group, approved the state bylaws, and then it became necessary for each region to look at their existing bylaws or their non-existing bylaws to see that we are in agreement with the adopted state bylaws. So going forward, these are the districts that I have heard from. I hope I'm correct, and as we go on, let me know if I've made a mistake. Capital District 3, Scott Brady sent the newly adopted bylaws from his group that were included the conflict of interest clause. Finger Lakes Region 1, Karen reported that her council adopted the state bylaws as their own. Brooklyn Region 4, Deb reported that her group is still working on the update and hopes to get it done before the holiday. True. Staten Island, again, also is still working on updating their bylaws. That's also Region 4. Broome, Region 2, Gail reported that they adopted the revised bylaws on November 11th. Bronx Region 4, Tina sent in the bylaws that they have. I have not received any update on them. So I didn't check them to see if they have all the components, but I'm sure that they're working on it. Ann Scherf provided Region 1 South the bylaws, and it does contain a conflict of
Conflict of interest. Yeah.
It's been a tough morning for me.
Yes, I totally understand.
Hudson Valley Region 3, Maria said that her group is in process of reviewing their current bylaws. That is the information that I have at this point. As far as we know, every region except one has done the conflict of interest. So therefore, any region without the conflict of interest statements is really not a legal counsel. So that needs to be taken into consideration. Is there anyone there who wants to correct anything I have said about the submitted bylaws? Did I miss anyone? I have a few other things I need to go into.
Can I ask a question?
Certainly.
Okay, one thing I want to clarify for Brooklyn, we need to attach that we have to, everyone must fill out the conflict of interest form. Should we attach the conflict of interest form to the actual bylaws, or that can be done separate?
No, that's a separate issue. And it's remember that unless one signs the conflict of interest, you cannot be a voting member of the council.
Thank you for the clarification.
Okay. Any other corrections to me as far as what I have reported as what groups have come in? All right, there are a couple of questions that have arisen regarding the state approved bylaws. The first one is in Article 2, which is on page 1. very first sentence says, members of the statewide committee shall elect a chair or co-chair with the option of electing a vice chair and secretary from among its members by majority vote. Such elections shall take place biannually at the last quarterly meeting of that year. And then any statewide council member may be nominated for these positions. Such nominations shall be called for and made to the existing or outgoing chair, co-chair 30 days prior to the last quarterly meeting. Since these bylaws really were designed to go into effect in December of this year, the question remains, what do we do to stay in accordance with the bylaws? We now have acting co-chairs. Do we keep those folks until December of next year, when we can abide by this for an election at the end of the year with providing the 30-day prior notice? We need some clarification on this.
Hi, this is Eileen Haynes, the general counsel. I think your suggestion is fine. The other option you could do is to have the election for the chair and vice chair at the next meeting, the next quarterly meeting, which is in March. So it's really up to you folks. If you want, the acting chairs would stay in their position until December. If you wanted to wait until December, otherwise you could do that in the next meeting.
So in other words, we don't have to adhere to the letter of this law. We can, in a sense, float along here a little bit. We can decide to do a new election. So it would have to be the second quarter because we'd have to get 30 days prior and all that, or hold off for another year. Am I correct in that summation?
Yeah, that's correct. I mean, going forward, we should adhere to the bylaws, but as you said, this is a kind of.
Right, but it's just to get back on
those bylaws, and we haven't met the conditions of the 30-day requirement. So I think it would be fine to have the election at the next quarterly meeting. But if you wanted to wait until December, that would also.
So it seems to me that the group needs to discuss this further at how we want to proceed with that, correct? Which way we want to go? Do we want to ask the current co-chairs to stay on for another year? Or do we want to, in a sense, have a special election within the next quarter?
Do you want me to make a motion about this so
Well,
that we can?
I would like a little bit of a discussion from the group, whether we're going to table that. Did the two co-chairs run out of the room and are on the throughway now? Or they don't want to even hear this? What's going on?
So the election.
Gail, are you here?
Hello?
Hello,
You're
ladies.
sitting in the room still. It's Alexis speaking right now. So the election itself is not something that's gonna happen during a public meeting. So I might just suggest if you want to talk about this outside of the public meeting and decide if you want to do it formally at the next meeting.
Well,
then
that was really is my suggestion, that it becomes a discussion for the statewide council in a Zoom meeting other than this meeting.
Yes, yep.
Okay. All right. All right, the other question remains. Now, if each area, each region, each council has adopted new bylaws that they feel are in concert with the state bylaws, what's the next step? Do we have our local person review them, or does state council need to review them, or is our word good enough? What's the next step?
I can answer that. So if you can have your local bylaws elevated to our central office FSS mailbox, we will share those with council. And OPWD council is asked to review those just to make sure that they're in compliance with our other state regs. as appropriate. So if you can just elevate those to the central office mailbox, we will take a look at them and we'll communicate back with you if you're good to go or if there's anything that has been flagged there.
All right, so this really is to all the councils. Please get your bylaws to me as soon as you can so that we can get this process moving along. Other than that, I think I've covered the areas that I'm supposed to. Okay, all right, that really is my report.
Thank you, Mary.
Okay, I'm
Next
you.
report we're going to discuss what is the RFP needs assessment. So the RFP subcommittee has met a couple of times since our last meeting. We were asked to come up with a needs assessment tool that we could share with the local councils. Hold on. Somebody's next to you. Sorry about that. So we were asked to design a tool, priority need tool, that we could share with all the local councils so that they could use the tool, not mandated to use the tool, but at least to get started in identifying priority need in your area. So what we did, we have Tina Veal on the committee, Mary Suchi Kozak, Chris Palega, and myself. What we did was we came up with a survey that we distributed all across the state. And we're going to give you an example of what it's going to look like. Look at the next slide, please. Maria Suchi Kozak will go through the slides and she'll explain and I'll help her. She needs any explanation for each slide.
Thank you.
I'm sorry to interrupt, but it's really hard for Mary, myself to see it.
No, just we can move closer. We're okay.
Can you make that larger? Okay, so it starts out by just a very brief description of what we're trying to accomplish with sending out the slides. Excuse me, not the slides, the survey. And just a little bit about the survey. We don't go into great detail about what Family Support Services Advisory Council is. We're sending it through channels that already have familiarity with our client base and who we are for the most part. And there are other.
May I make a comment about that?
Yeah, I was about to say there are other tools out there that further explain what Family Support Services is, but go ahead.
I think and our last meeting was just the other night. I think what we talked about was this is a quick survey. We want people to find it very easy to read and breeze through so that they don't get bored. But each of the local councils can write on their cover page or their email in the body of the email to the providers separately to the parents and explain more in detail. So if somebody really wants to know, then they can. I think that's what we decided.
Yes.
And we may even come up with a sample first pages so the local councils can build on it, not use it or come up with something different.
So what I thought is going through these slides is what we could do is I'll go through them not too quickly, but quickly enough. And you take a look at them and let's hold off questions because some of the questions you have may be answered as we go through them. And then we could circle back specifically to discuss, if there are some issues that you may have with it. So then we go on to identify who's responding to the survey. And of course, we want the eligible person to be able to respond, the parent, guardian, possibly other family member who may be a caregiver. And it goes also all the way down to providers or care managers, CCOs who might be working with the client base and feel from their experience that there are needs for their particular base. We asked to identify the
community that you're answering for, so that we have an idea of the needs across the state and how they break out. We are rating them on a scale of 1 to 5. We talked about whether that should be 1 to 10, 1 to 5, but I think it's just easier to gather the information and talk to the person who's responding and not force like lots of thinking, am I a 3 or am I a 4? And then what we did was we have the first category, and we're going to modify this a little. I mean, there are 14 categories on the website from the state. So we used those categories that are already posted on the state website for this survey. And then we give an opportunity, when I'm not going to go through all 14 of them, but each area is described. So that's the description that exists out there in the brochures in terms of what advocacy support it looks like. And then at the very end, if you don't mind clicking through advocacy, then that's after school. Keep going. Okay, so we broke it down by age group because I think it's important to understand our population who lives at home, how they break out. We know that the needs of the younger ones are going to be completely different from the needs of the older group. Next slide, please. And then, of course, we're doing a write-in because we anticipate that there might be some needs that are outside of the categories that we've identified, or maybe somebody has a different spin on what it means. And so they have an opportunity to write in what they feel your community needs. Next slide. And then, of course, we were hoping to also benefit from people taking the survey to be potentially more interested in coming on board and working with us. Okay, and then optional, I would believe, but if somebody wants to share information about who they are so that we can contact them. And thank you. Thank you, Chris, for working on this. Really appreciate it.
Yeah, sure. So one thing that I just would point out in that last question, we're asking if people want to.
Oh, we can't hear you, Chris. I'm sorry.
I'm sorry, can you hear me now?
Yes.
Okay, yeah, so just one thing that I wanted to point out is on that last section of questions where we're asking about members if they want to join the council, we won't ask them for contact information unless they click yes. If they click no, they're going to bypass that contact question and go right to the thank you page.
Chris, could you also explain to the statewide how you're going to collect the data and how they will receive it?
Well, I mean, we should really sit down and talk about distribution, right? We had talked something about distribution, that you know, all of our local statewide representatives could begin, you know, once we're ready to launch, using that survey with the contact lists that they have, and listing friends and other contacts that they might have. We can certainly discuss broad outreach to the provider network, and I think a lot of times the provider network is the best way to reach forward to get to, you know, the participants and the families, which we don't really have that data, but the providers do have it, and they've been really great about reaching out. So it would be, you know, the idea of leveraging that as well as talking to other people that we know, that all of us know, right? If we know, you know, executives at a provider agency or a you know, provider organization who might be willing to help us by, you know, placement in one of their newsletters, or maybe they'd be, you know, willing to do an email burst for us to their participants, their members, whoever, to try to increase the numbers. You know, all of those things are possibilities, and I think it's a strategy we can put together and coordinate without too much trouble. But it is, you know, some work to try to get it together and to get it organized and launch it. And I think it's going to be successful. I think it's a really good survey. There's a lot of good input from the members of the RFP subcommittee on how to move that through. So yeah, I mean, that's the idea. I think we need to decide on you know, nail down that distribution, but there's a lot of channels that are available to us to try to move that forward.
I think the goal really is to make sure that we hit the current distribution lists that we have. We're all pretty well connected in our communities. So that would be really our number one priority, as well as the CCOs who have, you know, a huge population as well. But I am curious about the timing of this, because I know last time we talked about the RFP and when you expected us to be ready to go forward with it. And, you know, there's a process that you have put in play. I guess when I say you, I'm referring to the OPWDB team. And we're not, you know, we're doing the best we can to get this out quickly, but we don't have a guideline as to what your expectation is for us to, okay, guys, here's the RFP and let's go.
Okay, no, appreciate that. I mean, I think at the end of the day, you know, we're trying to get this money out as soon as possible, right? So, but I think I know that you're in the process of looking at the needs assessment, trying to, you know, identify our region, what the needs are. So we're going to be willing to work with you guys in whatever timeline we think is appropriate. We know that typical, right, competitive procurements take about 6 months from start to finish. So with that in mind, you know, the sooner we can start the process, the sooner we can begin to award those.
Sorry.
And start to see money in support of those objectives. But so ideally, you know, we'd like to start and hopefully commence the procurement process prior to the end of the state fiscal year, which is March 31st of 2024. But knowing that, you know, our experience with screening data is that many times it comes back not usable, and there's a lot of back and forth in terms of questions. So, you know, we can work with you guys on that timeline, and maybe what I can do is work with, you know, with SPS and my contracts team, pull together a general timeframe for what that 6-month period looks like and share it with you, and then we can decide how much time you all need to kind of, you know, review and take in that data, and then determine how we want to write some of those, you know, those RFPs to solicit the services that each region.
Kevin, could I ask, when I think about, you know, working with RFP to try to put together, you know, the kind of distribution that's going to generate the numbers we really feel like we need to do something that's effective. If we were thinking in terms of a timeline of a certain launch, say like mid-January for completion end January, and then be able to turn out data mid-February, does that kind of timeline seem to be unreasonable?
No, I don't think so. I think it sounds like that would probably put us, that we can start the process, right, and begin to put some scopes together of what we want to, the services and support that we want to try to procure, right, in that month of March, which means hopefully we could begin to kick off, you know, the notification, the notice process and everything. So you register, you know, by April 1st-ish, right? That would be a great goal of ours, knowing that we do, you know, our own internal procurement guidelines do, you know, get pushed back a little bit due to, you know, some other reasons. So I think
Right. I mean,
that seems like that's reasonable.
Yeah, I mean, that's great, because I mean, there's a few things going on right now. As parents, we're all already, you know, crunched for time, and it's a lot of work to try to get this together and organize it and run it through. We've got Christmas coming up, we've got, you know, all that going on as well. So I think if we can do a kind of a really focused and thoughtful program as far as distribution, it's going to lead to a lot better results, and I think everybody that's our ultimate goal, right? So yeah, that would be great.
Yep, that sounds good.
Deb, do you have a question?
No, it's Mary.
Oh, Mary.
Question, first comment, I think you've done a great job, the folks who worked on this. My concern is the collection of the data and what happens to it. Is there a way in which each local could just use that survey within their council area rather than trying to get it all up to Albany and have to go through everyone getting? It seems if we did it on a regional basis, the information would be more timely.
Right.
I thought we were going to do it on a regional basis.
Yes.
Mary, so on the question, what is your county? When somebody puts Suffolk, Nassau, that information will be for your council. Once,
Yeah, I know, but by the time it gets to it, in other words, our council has its own mailbox. If we were to utilize this survey and distribute it ourselves and get the results ourselves, it seems to me that it would take the burden off whoever is supposed to collect all of the statewide data, and then we could send the National Suffolk data to Albany, so that we could have it to work on. It's just a suggestion, because what's going to happen to all that data? Who is going to be in charge of collecting it and distributing it?
Mary, Chris will answer that question.
Sure.
Yeah, so Mary, I think actually, I understand what you're saying. I think the simplest way is to keep things as under one roof as possible, right? And that's why we had the county question, because once we have a list of counties connected to local advisory groups, we can easily sort that data and send it right out, right? So the way the data collects, it collects in the cloud, in the survey platform. The survey platform is called Survey Sparrow, right? Once the survey goes out, within 2 weeks, we'll probably be through with it, right? And we'll have whatever data we're going to have. Once
Chris,
we
but
have that data,
who is going to do that? Are you going to do that? Is the committee going to do
it's
that?
it's not hard work. I mean, it's work. You got to sit there and do the work, but it's not anything that's so complex that I can't just sit there and grind it out, right? It all goes into a database. It downloads, I can download it as Excel spreadsheet and then turn that into charts, graphs by local council, by county, by whatever it is. It's actually the simplest way to do it, is to have all of that data in one place. Now, once I have it, once we close the survey, I would say probably within a week or so, I'll have that data organized in a fashion that I can hand it to every single local council based on what their needs are in the form of charts, graphs, whatever, however you want to display it, right? So I don't think, I understand the concerns on that side, but I don't think the data concerns are something that we need to address beyond what we've got in place right now. I'm sure that I can turn the data on, and even internally, I can probably run reports for anyone who wants to see how are we doing in our area. As long as we know what counties you're covering, I could even produce interim reports out of that. It's just out of my area, right? So for me, it all makes sense, because that's,
I mean, I totally understand what you're saying. I guess what I'm trying to do is not burden you.
Right, but it's a software package, and I think, like SurveyMonkey, I mean, it's all computerized, it's all going through, as Chris explained.
Yeah, but somebody has to sit there and do it.
If we start breaking it down by council,
I mean,
I think it's gonna become overwhelming to come to some kind of cohesive position.
And Mary, I had already asked
Yeah,
Chris if
I
this
have a
was too much
question too.
for him, and he said it's not, so we're good with that.
yeah, I can take care of it. I'm very confident that it's not going to be, it's an important task. I'm more than willing to do it. And like I said, I don't think it's going to feel overwhelming whatsoever. I'm going to be glad to be able to get that data together and get this thing moving forward.
Yeah, I think you folks have done a great job.
It's a great survey, I agree. But I have a question. Region 4, New York City, is on a different fiscal year than the rest of the state. We're from July 1st to June 30th. How will that affect RFP and also / surveys?
Yeah, this is Kevin. I don't think it should impact, oh, did I turn it off? Sorry. This is Kevin. I don't think it should impact it at all, because if we're looking to issue the RFP on 4/1, no provider has that fiscal year, right? That's the state fiscal year. Many providers are either on a calendar year basis or a local fiscal year basis. And I think that, we have an ability through making spending plan modifications to, do things outside the process. Like the way we award the COLA funds after the budget's been enacted through contracting mechanisms. So I wouldn't worry about the timing of that. I mean, that's something that we'd all be, able to work through with the providers. They're accustomed to it. They respond to RFPs on, quarterly bases anyway. So I think that's something that we'll be able to work with and the provider, so, be able to execute, and we can adjust, when those contracts start, if the provider is concerned about overlapping fiscal years, so that we could, because we'll still, even if we start the process in April, we're still gonna have to allow for public notice, we're gonna have to review and score proposals, right? Make sure that they were submitted, the package was submitted in accordance with what, documentation required them. As you all know, we have issues getting contracts signed, right? They may be stuck in the system somewhere, so the process will commence in April, but probably realistically won't conclude until October or November of, next calendar year, based on my own experience.
Right, because the reason I'm also asking is when we do these surveys for you, I just would like Chris to know that New York City is on a different fiscal year than the rest of the state. That's all. But you're doing a great job, Chris. It's a great survey. It'll be a lot easier for me to get a lot more families to fill it out. So, thank you.
And just remember, everyone, this is only one tool. You might have your own individual interview process or meeting with family members or providers. This is not the one and only tool to use. I do have a question, and it goes back to what we're hearing, that less children are getting waiver services under the age of 8 in some parts of the state, under 12. And in Region 4, the entire Region 4, the 5 boroughs, our family support programs are to support families, like with family reimbursement, support groups, transportation, where traditionally family support programs funded respite, after-school programs, Saturday recreation, evening recreation. And now all those programs were waived, so you have to have the waiver to partake in those programs. Now, as we're hearing, these young children are not getting the waiver, or may not be getting the waiver. I'd like to know if Region 4 could fund those type of programs that are currently waived as a straight state dollar program. Saturday rec or after school program could now be under family support.
Yeah, so I think what we want to do is just, first of all, see what the result of the needs assessment is, right? If that truly ends up being a gap and that's a recommendation for a contract, then let's talk about it when you have those results. But I think we're obviously in a different space now, right? We've got a policy that is very clear about reasonable indication of need. And if there are light touch services that can fulfill the needs for a young child under FSS, then that is absolutely the route that should be taken. So if that means that we need to assess those services for filling that gap, then that can absolutely be done as part of the survey process. And I know that Anne Marie Peterson is on too, so I didn't know, Anne Marie, if you wanted to add anything to that.
No, I think your response is the right approach, that, let the needs assessment go through and we'll go from there. I think that at that point, understanding we would explore what it is for each region. So, yeah, I don't have more to add.
Thank you. Now I have just one little follow-up. So if we see that there is a need, we see that there's this shift, is it maybe the time, this time of year, that we should be advocating for more family support dollars in the legislative budget? Because I recall many years ago, new monies, when we requested it, had to be a line item in the budget. So what are your thoughts about that?
Yeah, and Kevin can certainly correct me if I'm wrong, any additional dollars that we spend on any program need to be appropriated through the executive budget. I think, probably some of the survey information that you're using and information that, you have on how the dollars are spent, what they're being used for, would be critical, for demonstrating the need. And I think also, for you guys to think about as advocates, right, is, thinking about the service system as a whole, right? And where's the most need, whether we're talking about investments in workforce, investments in service rates, investments in FSS, right? There's a fixed amount of money to be spent on everything. And I think as a system, you know, when we're in that place, we need to think about where we prioritize, and certainly, you know, the advocacy efforts of family members are really important, and I think the legislature, you know, hears them. So as you guys consider your advocacy around FSS, I think, you know, trying to take off the FSS hat and wear the global system hat, and where the monies are most desperately needed, is a really important thing for you guys to consider.
Thank you. Jen, you have a question?
More just a comment, Chris, before this is a final survey, you might want to review, the comments that have come in on regarding the survey, just to see if there's anything that should be incorporated into it.
Yeah, I mean, I'm absolutely open to feedback on it. You know, I think we're in a really good spot with it. I think it certainly works the way it is, and hoping that it accomplishes the goal. But certainly open to taking in comment and critique on it, as well as, you know, wanting to take a period once we're settled to test it, to make sure it runs the way we want it to run as well. So yeah, absolutely send in comments.
That there's some comments that are coming in during this from people on the webinar that are participants.
So typically, we would address the comments from the general public, I believe, correct me if I'm wrong, at the end.
If they're relevant to the current.
So, well, some of these seem to be relevant to the current topic. Do you want to wait until we get to the very end of our meeting, like we normally do for public comment, or do you want to address this now is the question?
So,
Isn't that what you were bringing up, that there were comments in there now?
Yeah, but it's just for Chris to review for.
yeah, I see a couple of comments coming in. I think that most of them are related to the FSS family reimbursement section of today's agenda, so we can, I think, definitely cover it then. One other thing for consideration, just something that we have kind of seen from our own data collection standpoint of if you have a type in for the county, it'll probably be difficult if people spell it wrong, or, you know, just again, creating extra work for you, Chris. So I don't know if you want to consider a drop down or something else like that, just to make it a little bit easier, so you don't have the variation between spelling Chautauqua and Onondaga. Different ways.
We thought about a drop down, and I looked at a drop down. It becomes quite a drop down when you're adding, I don't know how many counties in the state of New York, 40, 50 counties. It's a large drop down. I think, you know, error checking, if you know, Monroe or Monroe, those kinds of things, when you have the data in Excel format, you can sort and correct, I think, fairly quickly. I certainly am aware that there will be misspellings and a lot of things. I think we'll be able to ID it pretty well. But, you know, we could talk more about a drop down. It's just that, you know, it's a drop down of 8 or 10 is one thing. A drop down with 50 items in it, you know, that's, I think, a little long.
Understood.
Any other questions?
No, Brooke, we're fine here in New York City. Thank you.
Okay. Next, we're going to have, I think, Gail. Oh, advocacy. I believe the advocacy. No report. Scott is not here today. Mary McGuire is to just.
Yeah, on advocacy this morning, we have no reports. We will discuss what we need to do with the council.
Okay. Gail, would you open up with the progress with the ADM family reimbursement?
Certainly.
Certainly.
Certainly. The ADM committee has been collecting some feedback from around the state about items that are currently on the non-allowable list that we feel deserve some reconsideration. That list has been provided to OPWDD and it is currently under review. We're hoping to hear about that in the coming months. In addition, we wanted to inquire about the statewide survey that OPWDD launched specific to the FSS ADM to collect feedback if that was available. Could you give us a status update on that, please?
So we actually are going to cover that during our updates, but Nick, do you want to just provide a quick, we'll shave off some time from our updates this afternoon?
We can do that. The 30-second response. We sent out a survey to FSS providers in October that closed on Halloween, I believe. Amy can probably explain on that. So we've collected those. We're in the process of analyzing them. So we don't have a real truthful update. I'm gonna go a little bit further into it when I speak later in the meeting, but that's where we're at. And obviously, CKL's comment about updating the allowable and not allowable. Obviously, some of the comments we received from those surveys were along the same lines. We are taking that into consideration.
I'd like to turn it over to the subcommittee chair, Deborah Gray.
Thank you, Gail. I just, before I go into my report, can we take down the survey so we can see more of our fellow participants? Thank you. Okay, first of all, I have been getting yelled at a lot by certain agencies, and parents actually didn't yell at me, which was very surprising, but nice. But there's a couple of issues. First of all, the allowable, non-allowable list. The biggest complaint is about the beds. Also about when you need the special covers for the beds, especially parents who need the beds because of either vermin or their children have soiling issues or have broken their beds. That's a big, big complaint. The other thing that I've been getting a lot about is that for families whose children live at home with them and they have a care manager. The problem is the the life plan, and they have to do an addendum. They're taking forever or not doing it. So instead of being able to get this information out, the agencies have to send it back to the parent and the care manager to get them to correct this. So this means that we need to see that the care manager staff need to know and be taught how to do the ADM. And I also would like this to be done for the families too. So we make sure that the families who have care managers will get it done. And this is a very big problem. The update list for how medical professionals have to fill out forms has gotten better. I've gotten less complaints by the medical profession, but the biggest problem is the not allowable list that used to be allowed. And a lot of people feel that parents are upset because they feel they're being punished if they ask for help. The other issue is the care managers are very overwhelmed and having trouble filling out the AD. They don't understand about the addendum. So this is a big problem, and this is affecting family reimbursement. This is one of the most popular, longest family support programs, and yet I don't know what we're doing to this program. Yes, we asked for continuity, but we didn't ask for this drastic change. That we didn't ask. So this is my report. Gail, if you have things you want to add, please do. If anyone has questions for me? Too?
Thank you, Deborah.
You're welcome.
Okay. I just have a couple questions, Deb. So on the care manager updating life plans, you mentioned that there was, I guess, difficulties in doing the addendum. Is that, like, what exactly was the feedback that you heard from the care managers? Because if we can have as specific as possible, it will just make it a little bit easier for our handoff to the CCO team while they're doing an evaluation at the moment. I just want to make sure that this is something that's flagged as part of the evaluation. So if you have any more specifics about that, that would be very, very helpful. And it doesn't have to be-
Now, Alexis, you
Well,
want me?
if you haven't, I'll take
Well,
it.
Alexis, when I've asked the care managers, they don't want to answer us. I have been doing site visits virtually with my local DDRO. We've done the reimbursement programs. And the same thing I hear over and over. Care managers are not putting the correct addendum in the life plan for the family. So that means that they have to send it back. And that's what's delaying. That's one thing that's delaying the actual filling out of and for the family to get the money for the allowable list. We need, and the same thing they keep telling me over and over. I did over 5 agencies, and the same thing I hear is these care managers need to be retrained. They're frustrated and angry, the agencies, because they want to pay the families, but they can't because the care managers don't seem to understand what kind of paperwork or the addendum, or not the addendum, to do what you're supposed to do for the life plan. If you don't have a life plan, actually, it's a lot easier. I mean, if you don't have if the families who don't have the care manager, then it goes with, they need to see the psychological, psychosocial, especially if the individual has tab numbers. Actually, it's a lot easier because there's no, they don't have to worry about someone adding an extra piece in a life plan. So I don't understand why it's hard. I remember when it was case management, Medicaid service coordination, they knew how to fill out that, yeah, we're going to need reimbursement, and this is what I requested. The receipts were put in correctly. I have the correct justification letters. If they needed medical documentation, it was in there. Now, we don't understand. That's the biggest thing that agencies are complaining to me. Because we asked them, what is the issues? And they first said the last meeting, yes, they did complain a lot about the medical. It's very hard to get doctors to fill out those forms because they didn't completely understand the guidelines and how you wanted it written. But now all I'm hearing is the care managers are not filling out the life plan correctly. I'm not a care manager. I don't understand what the problem is, because I know when you have to change a service, you need to add it in with the date and the correction. So this is the best I can tell you, Alexis. I also think maybe you need to also have meetings with your local family sports / reimbursement coordinators and let you know too what's going on, because they're just as frustrated by the same issue as we are. I hope I answered you.
Yes, and then some. Thank you. So my question, a follow-up question to that is it concentrated in one part of the state, or is this something that you're hearing across the board? Because even knowing if there's like a certain geographical spot of the state that's having more difficulty over another is just helpful for that focused technical assistance.
I can only answer for the area that I'm in. I won't say that it could, I will not say it couldn't be in another part of the state, but the issues happening in Region 4 is the region that I live in and I'm doing this with. I did ask the coordinators, if they, the coordinators I'm working with have, do you know of other parts of the state? And they're not sure either. I think because they're very overwhelmed with all the work they have to do, and they're really doing it's a hard job. I understand that.
Deb, I could add a little bit to that if it's helpful.
Sure, thank you.
Myself and a few of our colleagues sit on a number of other committees and meet with people across the state. And I can tell you that hearing that care managers are waiting until the next life plan to add new services. Community Have R is one of them. FSS services is definitely one that's been affected by this. That's all across the state and many, many regions. We hear that from a lot of different families. And it is a barrier to accessing those services.
Thank you, Gail. I appreciate it. Well, as you see, Alexis, you did get our answers. But I would like also that you see that as statewide members and the advisory council members are updated and briefed or have like paper part of even going onto the website so we could see how the life plan piece, they're supposed to do the addendum. Or, so we understand because we'll get parents calling us and agencies, because remember down in New York City, we have the 5 developmental disability councils that come out of the New York City Department of Health and Mental Hygiene, and they're complaining to us too. So I understand the frustrations, but we have to do more training of the care managers, because this is affecting this program, because this program, when it's done, is very good and successful. We don't want to lose this ever.
Thank you, Deb. So just a couple of things to respond there. So we do have our CCO team, and I think they will be joining us later today. So we touch base regularly. I will make sure to share this feedback. Like I said, there is an evaluation that is underway. So this is actually perfect timing to be raising this concrete example of a challenge that's impacting access to services. So we will absolutely share that feedback, and I know there's a plan to share updates on that evaluation. What I can also do is just coordinate with the CCO team and understand what kind of trainings are already ongoing at the responsibility of the CCO in terms of filling out the life plan and doing addendums, because if this is really a challenge across the entire service system, not specific to FSS, we need to bring this to other forums and ensure that that training is concrete, and if there are any gaps in that, we will make sure that we address that. The other thing, separate from CCO and care management, on the clinical justification, it did come to my brain earlier this week after hearing about the report out from DDAC on that systems committee, where there are a bunch of doctors, that might be a helpful committee to kind of defer some of the conversations about the difficulty in getting a clinical justification from healthcare professionals, because that isn't something that is just specific to FSS. Doctors have to support people with developmental disabilities, and making sure that they truly understand what clinical justification looks like for someone with disabilities is incredibly important. So to just not pigeonhole us in the FSS lane and expand that conversation to the overall systems committee may be an idea, just to broaden it to not just FSS. So that was one thing I wanted to make sure to bring up.
Just I want to say, Alexis, when it comes to the medical profession, I understand what you're saying, and I'm glad that the DAX committee will, you have the medical, but you see, I have doctors that have worked with my son. They understand his developmental disability, but they wanted the guidelines because they know how to write a justification, say, for Social Security or Medicaid. But when it comes to OPWDD, they want to make sure the guidelines that are geared or what are they supposed to put in? That's what they've asked. And it doesn't mean that they're not trained, but OPWDD is not Social Security. That's what they're telling me. They want to make sure they're given guidelines that are specifically for OPWDD.
Thanks, Deb.
You're welcome.
If I could just circle back to the allowable list that we provided to OPWDD. I just wanted to give a little bit more information. There's been some questions about that. At this time, the list only contains 15 items that were gathered from comments from around the state, and those are being reviewed. We will lock that list up, but also send that list out so people can see what's currently on that list and continue to add to it. We will be having ongoing dialogue with OPWDD about items. This was not a one-time submission. This is an ongoing dialogue between family support representatives and OPWDD. So there will be lots of opportunity for others around the state to add to that list for consideration. And we will share that soon so that you can understand all the pieces of information that we're looking for to make sure that that is comprehensive, so that it can really be considered.
Thank you. All right, so now we have stakeholder engagement to report. Both Chris Flegger and Fiscal have worked on a new member recruitment brochure, and Chris is going to discuss that.
Great, thanks so much, Kathy. Stakeholder engagement, I mean, currently right now, we're like full on focused on trying to get new membership drive up and running and getting some new members on board so that we can have full coverage across the state, right? At our last meeting, we talked about the importance of being able to make local connections with prospective members and about the need for some local councils to be able to collaborate, as there are a lot of local councils not fully functional. You know, in order to be able to establish those local advisory council contacts across the state, you know, these are people that can reach out from a local perspective to new member prospects, right? I think at this point, we're at a place where enough of this is set up for us to begin the outreach, right? So part of that outreach we talked about earlier digitally with the needs analysis survey. I think there's potential for a lot of interest to be generated from there. The other thing we talked about last time when we met was a brochure that was specifically designed for new member recruitment. That's what you're looking at here on your screen now. The way we set this up is a trifold brochure, right? So there's 3 panels on the front and back that fold into one, and that we can use. What we did is try to set it up in a way so that we could kind of walk the reader through the what, why, and how of family support services, right? So when you're handed the brochure, what you're going to see is that panel on the right. That's just the title page introducing what it is, right? And as you open the brochure, you're going to see that panel on the left of what is family support services. It provides some information on the what of FSS and does so with a list of some of the programs that may be available. And as you open up to the inside sheet, if we could get the next slide. You'll see that we use council member testimonials to talk about the why. These testimonials really speak to how membership has naturally made our members more knowledgeable about local program opportunities and more knowledgeable about navigating the system of care. What's I think is really important in these testimonials is they speak to how meaningful it is to be able to take this information that we've learned as council members and to be able to use it to help other families in their local areas who may be struggling. And we're running ahead of time here. I just want to take a minute to read these testimonials to you. In case somebody out there is maybe thinking about this, this is what our members say about it being a meaningful endeavor to be part of our group. Families and caregivers should consider joining their local family support service council because they know what it feels like to need help and support while raising a child with a disability. Getting involved, learning about local services and resources, you become a powerful asset to other parents in your community. We all need light on dark days, and joining the FSS Council provided me with inside knowledge and understanding of what is out there, how to access it, and allowed me and my family to become a beacon of hope to other parents as they embark on their own journey of discovery. It is not an easy journey, and no one needs to go it alone. In our third testimonial, joining Family Support Services Council provided our family with friends and allies that helped us along the way. The programs I've learned about and shared with other parents are amazing. I'm excited to be an ambassador that gets to help share the knowledge I learn along the way with others. And so I'm just very impressed. I've taken in a lot of testimonials in the last few years. I just want to thank the local council members for sending those in. Fantastic, right? The center panel on the inside discusses what we're trying to accomplish and a bit more about how we go about that. And moving to the left panel, I think this in some ways is a reflection of the testimonials, right? We're directly trying to speak to learning more about the program and the opportunity to use this knowledge with the support of fellow council members to try to make things better. And if we could go to the next slide, please. So when this is folded up, the center panel, you see, becomes the back of the brochure. We wanted to reinforce the idea that participation is meaningful. This is so important when we're trying to engage new members whose lives are already filled with challenges. This is also where we present our call to action with several pathways that a prospect can use to take the first step, reaching out for conversation. You'll note white block at the bottom, that is a space where local councils can fill in their own local contact information when they're handing out at local events or wherever. You'll also see that there's a web address and a QR code. If we go to the next slide. Yeah, the QR code and web address resolve to a simple contact form. We'll collect just enough information for the committee to respond with a local council representative. And then the next slide. And then we're also going to provide an opportunity to share any initial thoughts, questions, or concerns that a prospect might have. I want to thank committee members, local council members for the input that I received from them to help develop this content. And I just really want to, give a special recognition to Crystal Vossler. She's my partner on the Stakeholder Engagement Committee. She took that content and turned it into what in my mind is really an agency quality piece of work. And I really appreciate the leadership that she took on that. So thank you very much, Chris. At this point, I just want to ask if there's any questions before I start discussing next steps.
There were no questions.
Okay, so I guess the first big question is how do we produce this? We need to print it, right? We discussed, I think at the last meeting, Kathy had brought up the idea that we would see if we could engage with OPWDD, if they would be willing to print a bunch of these brochures for us so that we could start outreach. So I guess the first question is that something that OPW is willing to try to do with us? And what kind of process are you looking at, if so?
So Chris, I'm gonna take Kevin, our CFO, off the hot seat and answer for him for a second. So when I brought this up, we had a conversation about it, just in terms of if we were to print this, right, all in English, and I think you have a range of 3,000 to 5,000 of these brochures per local council or per region, that is obviously a large cost. And that does not make it accessible in other languages either. So we did want to just have a conversation about this because obviously there is a $3,000 budget at the local councils to access, and printing brochures 100% falls under that allowable expense because it is tied to what your duties are as recruiting members. So I think we should probably just first start and talk about accessibility a bit more. Because if there is an approach here, I think about how this is going to be more accessible, we just need to understand that printing brochures makes the most sense. Where are these going to be? How are you going to ensure they're in the languages that people need, and all of that?
Yeah, I have not considered alternate languages. Like I brought it this far along, and that's why we're here with the questions. I mean, as far as printing, I know you put out you said several thousand per local council. I'm not sure if we need to print those all at once, and what those quantities might be. I mean, not to speak for anyone else in my mind, I was thinking, if we could put 500 brochures in the hand of each council as a pile to get started with. I did a quick check online with an online printer at the recommendation of the agency that I work with for my business. And it looked like we could print 10,000 of those for about $1,000, and that would get like 500 per. Now, if we're needing to do different languages based on requirements, we would need advice of counsel's office and some guidance on, how to go about that.
And I think we absolutely could help with translation. We already have a contract, we're translating materials on a regular basis too. It's just a matter of, is there any thought of how you're going to request what language people need? Because I think if we're looking at the state to cover the cost of something, we don't want to be printing things that aren't needed, but we also want to make sure that it is accessible. So that was really the big question mark about, this falling under your $3,000 budget versus the ask that I said I would bring back and see if we can absorb the cost.
Okay, so let me just backtrack. I mean, what are the requirements for us to, obviously we'd want to make this as accessible as possible, right? And we may not need to print obviously as many in perhaps Chinese or another language as we might need to print in English, right? That, I think that's evident. But what are the requirements for us to do that? What do we need to, what bar do we need to hit on that? Do we need to be in these certain languages? Is there state policy that's involved in that? Can you provide guidance there for us? Because I'm just a dad with some marketing skills right now.
Absolutely, and they're very good marketing skills because this brochure is beautiful. So there are the top 12 most spoken languages in New York State. So we're held to that requirement as a state agency. And you'll see that we have all of those languages that the FSS family reimbursement application was translated into. And we took that a step further when we learned that there were a handful of additional languages that families spoke in our service system according to tabs. So if you look at that portion of our website, you will see all of those languages that we've already started to translate things into. Like I said, we can help when you have a final product, we can help with getting that translated. But another thing that had come up as a suggestion, and I know that there are going to be some barriers to this, but it was raised as an idea to have this available online as well. That might make it, more accessible for some, but less accessible for others if you don't have access to a computer or broadband or internet or anything like that. But that is another way that, it's a click away in whatever language you need instead of physically printing brochures.
Right, and I mean, that makes a lot of sense. I mean, you may look to print, even if you printed 1,000 in each of those 12 languages, you can print 1,000 brochures for a couple of $100. That's not a huge amount, but if we can set up a system, work together to set up a system where we can post this online, or if we can do it within, the OPW website, that would be fantastic. I mean, a lot of people, do have that access. I think one of the things that really drove this project was some of the local areas who were talking about, we have a lot of people who don't actually have that access to technology, right? And so we were trying to do that, and that kind of morphed into an idea that this is really a powerful tool to use for personal outreach, where we can attend events, set up events, and there's all kinds of places that we can be handing these out and trying to gather info. So yeah, there's that. So I mean, considering the 12 language thing, it's still a manual project. I guess my question becomes, how do we sit down with Kevin and discuss the possibilities based on the parameters we just talked about? Is that something that we can set up a meeting next week, Kevin, for a half an hour to talk about, or?
So Chris, I'm again gonna keep the mic away from Kevin for just a second. So
Sure.
if you just let me know when this brochure is final, then we can be your point of contact in terms of getting them translated, and we just need to talk about numbers, right? Like, we need to understand how many brochures do we need in each language. And then another thing that we have to talk about is there's a blank space on the brochure for a point of contact. And I think that we need to have a conversation about who that is, because as an FSS local council recruitment tool, I'm inclined to think it's more appropriate for a central contact of the local council to be on that and not the regional field office. But, you know, we've got to talk about that still and make sure that we're in agreement. But yeah, if you just, let's talk about the numbers and brochures that we need, and then I can discuss with Kevin.
All right, I'll reach out offline and see if we can set something up and bring in Crystal if we can, and anyone else who wants to come along. As far as that blank space, Alexis, the intention was for that to be local FSS Advisory Council contact to generate that local contact that I think is going to be most effective in trying to bring people into the group, right? So that is the intent, is to have local contact information there.
We have 3 questions, but I'd also like to make a comment first. And Chris, before we do anything, I think we should have a stakeholder engagement meeting among all members so we could discuss the amount, the languages needed, the contact information, and then we'll get in touch with.
That makes sense.
You know, and I think the thing, Chris, I was just gonna say, is probably getting some sort of parameter, right? I think Alexis mentioned, once the brochure is finalized, I presume there's no special paper or cardstock we want, right? But we can even look at, I know we've done a lot of brochures recently too, so we can look at what we're able to do is quote off of it, you know, an approved contracted vendor already. So I think once you guys are set, you have your kind of estimated numbers, we can then talk and coordinate with Alexis between all of us and, you know, try to get something done, you know, and we can decide how to pay for it later. I think to get the quote and to know what we, you know, what the size and scope and scale is probably.
Right. Yeah, so that's great. Yeah, so no, absolutely. And Kathy's right. You know, if we can, you know, in the near future promptly, you know, get together stakeholder engagement and any of the other members who want to attend, nail this down, put together a proposal on numbers for language and such. Anything else that you need, let us know. And then we can present. Like I said, we are focused on getting this brochure printed and usable. We have councils that absolutely are struggling and need to have new members coming on board. So yeah, whatever we need to do to keep moving this forward properly, I'm totally in favor of.
We have 3 comments, Mary McGuire, we first, then Deborah, and then Pam.
Thank you, Chris. I thought this was a fabulous thing to put out for the councils. I also agree with 12 languages. It's very hard. I know in Manhattan, we struggle with interpretation for our meetings, and it's very costly to have, you know, bring in people and then have the interpreters not used because people do not show. So I think if we stick with our, you know, the English and Spanish and make all the other ones available online, and if you need them printed, we can do that at the local TDRO offices, you know, or you can contact one of us, you know, through our emails or whatever, and we can have it printed, you know, in any other language that you have on your website, if people do not have that. I think it's silly to print more in 12 languages when you find the need base not be there. But I also think it's very important to take the 2 or 3 biggest languages and have it in print, because I think a lot of people are visual learners, our children are visual learners. And it's a concrete piece of paper that I think came out really, really nicely. So I would encourage us to move forward on this, but, you know, find a way that we can incorporate the languages using technology.
Absolutely.
And Deborah?
Oh, hi, okay, my questions and concerns. No, I do love getting things translated. I have had some of, in Brooklyn, we had a couple, we worked with 1 or 2 of the Asian agencies, and they're willing to do translations in the paper, but we also have a problem that not everyone looks. I get someone who speaks a language or a dialect that I can't, so I have to make sure that they let me know in advance so I can get the translation or someone sitting there for them. One, I can't pay translate, and what's a bigger problem for us is if we have people who need American Sign Language. My council can't afford the translator, so I'm like concerned, 'cause I want to make sure, is there ways that you could help the local councils apply for grants so we can get the translations and we can have, if, like for American Sign Language, we could say, well, we'll get a American Sign Language interpreter if you need, but we need help because, I only, I mean, I've had groups where I've had, who there's one or two people that speak perfect, they're able to translate to Spanish to English for families. Thank God we're doing it virtually, so it's easier. And I also have them with the dialects for Cantonese and Mandarin. Sometimes I have to do Taiwanese because it's the grandparent. But these are things like we need to know because translation can eat up your budget so quickly. It's not funny. So we want to know, one, is OPWDD willing to help our councils by applying for grants, or see that if there are ways we can get the financial assistance so we can be totally inclusive to our families who English may not be the first language, and also if they may need American Sign Language, and also if we have families who need Braille or other, because once you start, you have to meet the needs of everybody. So, because this is legal, because if you go to vote and you see the BMDs, they have the sip and puff, they have it for the people who are hard of hearing, visually impaired, they have it other languages, so we have to really make sure that we're doing this correctly so it doesn't bite us back. But I'm not saying I only think I'm against it. I'm for translations, but I want to make sure we can support it continuously so it continues to go on the right way.
Thank you for that. And Anne?
Okay, I wasn't sure if that. What I'd like you to consider is the literacy level of the brochure, and how does it reach the people that may not have the literary knowledge to read it and understand it.
Good point. We'll discuss that for a side meeting, okay?
Absolutely, yeah.
Any other questions, concerns? So I think it's time for a break.
Yeah, I just had a couple of more things on this, Kathy, if I can take just a minute.
Go ahead.
So one of the things that Crystal and I had talked about, once we got the brochure done and trying to assist with onboarding, is the idea of where the onboarding process is to generate for the statewide committee a standardized application form, right, for new members. So maybe Kathy, this is something we could talk about a little more when we get together, stakeholder engagement that we just mentioned. The other question I had for OPW.
Chris, we didn't hear quite what you said. Could you repeat that, please?
Oh, I'm sorry. Yeah, one of the things that Crystal and I have been talking about is the idea of developing a standardized application for new members to try to assist the local councils with onboarding, to try to streamline that process, or maybe develop some standardized processes. So maybe that's a topic that we can at least open up when we meet to discuss the things we just talked about, the brochure. Just an idea I wanted to have out there. I think that having a more standardized onboarding process, I think will make it easier for the local people to bring people on board, just with some directions. The other question that I had for OPW is that we know that the local FSS coordinators are not actively involved in recruitment, right? But we just wanted to confirm that regarding your involvement with the recruiting and onboarding. I mean, is there anything that OPWDD wants to have as far as involvement with recruitment, new member onboarding, any of that? Is there any conditions or things that you want to have as a participation with that, or can we just kind of go and run this on our own deal?
Yeah, I think that's a great question. If you have ideas already, I don't want to hold that up, but I do see some value in having something consistent in terms of, here's our service system, utilizing some existing PowerPoints and trainings that we already have available. So I think that could be super helpful if we just kind of share something that's consistently used across the state. But let us think about that a little bit more and pull something together. But that's a very, very good question.
Yeah, and I mean, we did kind of touch on digital outreach, but now that we've kind of incorporated and piggybacking on the needs survey, I think it's probably prudent to see what kind of results come from there before we line maybe too many people up. But I did want to kind of just finish in saying that I think that we're at a place right now where we can start to think about moving forward with at least some targeted digital outreach for councils who might be ready to get started. And, again, trying to move this brochure to print as soon as we can. So I want to thank everybody for the time, the questions, the input. Really helpful, and I really appreciate it.
Thank you, Chris, and thanks, please relate to so that we truly appreciate this brochure. We all love it. Thank you so much.
So just a few things for me, and I wanted to start off by thanking everybody for your continued commitment to the FSS committee and service to New Yorkers and their families with developmental disabilities. It's really important work, and I know that you guys all do a lot of put in a lot of effort. You're unpaid, and we very much appreciate it. Speaking of people who put in a lot of effort, our staff, our DSPs, I just want to give some updates on some of the areas that we're working to invest in our workforce. I know that as we were working over the summer to update our strategic plan and to give updates to our community about our strategic plan priorities, we continue to hear from family members, from people with developmental disabilities, and from our providers about the workforce challenges. And we as an agency continue to be responsive to those concerns. We have been working across our state operations system to increase the salaries of the DSPs whose salaries we have control over. The governor in the last 2 years has included substantial cost of living adjustments that have gone to all of our voluntary providers for them to continue to invest in their workforce and the continued cost of doing business. But I think we all know that salary increases alone are not the answer. We are obviously continuing to advocate strongly for our DSPs to have the wage that is, that they deserve to have based on the difficult work that they do. But we've also been working really on a holistic approach to how we support our DSPs. Because I think, we recognize that training, recognition, appreciation is all also very important in addition to the wages. So on that, we've had a couple of very exciting partnerships over the last year that have really developed and been very successful in the last couple of months, starting to see real results of those partnerships. First, we are partnering with the National Alliance for Direct Support Professionals, a nationwide organization that offers a certification to direct support professionals in the developmental disabilities field. We've been partnering with them to administer across the state with our providers, what they call their eBadge Academy, which provides certifications along the way for DSPs to take. And when they're done, it concludes with a certification as a direct support professional. We're partnering with over 30 providers, and at this point, close to 1,000 DSPs have received the certification, and we've heard really incredible feedback. We've gone across the state to visit with the DSPs and the providers who have participated in the eBadge Academy, and hearing really incredible feedback from DSPs who've been doing this for a short period of time, and including DSPs who've been doing this for a long time and have made a career out of this work, have all really benefited from the certification process. Along with that goes a small stipend to help DSPs get some financial incentive out of doing this, and also to cover the costs of additional things like people need to work a couple additional hours to finish their certification for babysitters or whatever they'd like to do with that stuff. So we're very excited about that, and looking to continue, to support that work, and hopefully expand it to additional providers. And then using very similar curriculum from the National Alliance for Direct Support Professionals, we've also partnered with the SUNY system, on 13 community college campuses across the state, to expand, to more community colleges, to offer, again, the certification for direct support professionals. And coupled with that, because of our partnership with SUNY, students who participate in the certification process can also get SUNY credits that they can use for degree matriculation. Those students are participating on campus. They're afforded the same opportunities that students of the college are able to participate in student activities. And again, we've had a lot of success. We've heard a lot of really positive feedback from individuals who participated in that. And we're also partnering with our voluntary providers across the state and our state operations team to administer that partnership. And like I said, been very successful. We've heard, again, really, impactful success stories from the DSPs who've done this. Folks have been doing it again for a short period of time, all the way up to a long period of time. And it's really motivated DSPs to, get back on campus and, continue to pursue their education if that's what they want. And one thing that we've heard across the board from the DSPs is that they feel valued, that they feel, they appreciate the investment from the state, they appreciate the investment from their employer in them as a professional, and they feel more equipped to do their important jobs, which I think for all of us is really gratifying. And for you all as family members, knowing that, DSPs are being enriched in that way and they're supporting your loved ones, hopefully that's gratifying for you too. In addition to that work, we're also working on a large-scale marketing campaign. We recently contracted with Vibrant Brands. It's a local marketing firm here in the capital region. And we have a work group of diverse folks from across our system, DSPs, people we support, family members, OPWDD staff, voluntary staff, working to create a marketing campaign directed at recruiting new individuals to work in the field as DSPs. So our kickoff work group is next week, where we'll begin to develop those marketing materials. And then we have several $1 million earmarked from our American Rescue Plan Act funds to do media buys in markets all across the state. So we'll be hoping to do commercials, print, TV, radio, buses, whatever, TikToks, wherever people consume their media these days. We're going to be trying to get there, just again, to tell the story of what DSPs are doing, why people might want to pursue a career in this field, and then hopefully some of the work that we're doing on professionalization and continued advocacy around wages will be the retention pool. So we're very excited about that work, and it will be available. The question we get a lot is it's not just for state operations and for all of the system. Really, the marketing campaign is agnostic about where people work. It's really just trying to tell the story of what a direct support professional is. Because I think, foundationally, there's a lot of misconception about what DSPs do versus what nurses do versus what CNAs do or home health aides. So really trying to tell that story about what a DSP is. And then I think, from the perspective of a person with developmental disabilities, how meaningful having a great DSP can be, right? And what that means for their life in terms of, being active in community and independence. So really trying to tell that story. We will have a partner website where people can go and learn about the various providers in their region. So if I go to the website and I put in my zip code, I live in East Greenwood, I can see which providers in that area do this work, and I can look at their websites and I can decide, which provider do I think I might want to apply to if I'm really interested in doing this work. So that all will be up and running over the course of the next couple of months, and we're really excited about that. The other thing that we're doing on workforce is partnering with the Alliance for Innovation and Inclusion and McSilver Institute, part of NYU, to understand the recruitment and retention challenges that providers are having and create a toolkit that can be responsive to those challenges. So we've done a couple surveys that providers and DSPs have participated in to give us a sense of what are the challenges in addition to wages. What's the rest of the story? So that we can help equip ourselves and help equip our providers to mitigate those challenges and hopefully be more successful in recruitment and retention activities. So that's the story on workforce. And again, I'm very excited about that. And if you want more information, I'm happy to chat a little bit. Just a couple more updates on some of the frequently asked questions we got. I think everybody knows also as part of our ARPA funding, we prioritized evaluations into some of the key program and models that we have as an agency, our CCO program, our self-direction program, and the continued evaluation of whether or not managed care may or may not be a valuable tool for this system when thinking about how we can better deliver services. So I think folks know that we have been working with Guidehouse to assess managed care. There were several town halls. I know a lot of you guys participated in those, and we appreciate that participation. Just this morning, actually, we launched a survey. So for folks who either didn't have an opportunity to participate in the town hall, or folks who did and still have more to say, or listened to the town hall but didn't want to talk, we have a survey that also is geared at capturing what are people's experiences with our system? What are people's thoughts about managed care? All of that will be really helpful as we continue to assess and Guidehouse continues to do its work. Guidehouse's report will be due to us in the spring of 2024, so right around the corner, which is scary. The other thing about Guidehouse is that in addition to posting the survey, we also posted the results of the town hall forums so far. So if folks are interested in what people are saying about managed care, what they're saying about their experience in the service delivery system, through the lens of those town halls, that would be posted on the website for folks to review and to understand. We've also been prioritizing looking at our CCOs and care coordination, and I know we had a really helpful conversation just earlier today in this meeting about where we need to see improvement with care management, and that's something again through the strategic planning and through our info gathering sessions as part of our strategic planning, we've heard a lot there. We have we are partnering with the CCOs to continue to look at ways to evaluate and to improve care management across the state. We know that it's a foundational service that people are relying on, and we hear its challenges regarding some of the administrative burden around care management and how that impacts access to services. And we're looking at the whole entire program soup to nuts so that we can continue to make improvements. And I am happy to say that the CCOs are also very interested in that exercise and how they can continue to improve the work that they do. And on our side at OPWDD, we're excited to understand program design in areas where we can improve there as well. So we have started up that work with the American Institutes for Research, and it's ongoing, and there will definitely be opportunities for stakeholder engagement there. And the last place that we've identified in terms of evaluation is our self-direction program, which I think folks know is a program that we're very proud of. There's a lot of individuals across the state, somewhere between 20 and 30,000 folks that are self-directing their services. And we believe, very much that it's sort of the epitome of what we want to do as an agency, right? Is help people to have the autonomy to live the lives that they want, up to and including their service delivery. But I think we also recognize that there are, again, challenges. That program has grown very quickly. And we want to make sure that the program is sustainable for the long term, and we want to make sure that it's accessible to a really diverse population of people. And I think what we know right now is based on the very quick growth of the program, that sustainability could be a challenge if we don't look at things. And I think we all know that accessibility for a diverse population of people is not a reality for the self-direction program at this point. And so we're very much invested in that. And looking at our existing program, making sure that we're providing sort of a plain language understanding for people with developmental disabilities and their families who are self-directing. And then also at the same time, looking at the program design, and investing in improvements on that program design so that we can continue to do the best we can with that program. So very excited about that, and we'll be making an announcement very soon about who that contractor is and when that work will commence. And again, the question that we always get is, how can I participate? And there will be a lot of opportunity for stakeholder engagement in that. And then also just a reminder that we really we crafted the proposal for contractors based on the feedback that we've gotten from family members and from people who are self-directing their services. So we really we believe that what we've asked the contractor to do is directly responsive to, the concerns that, folks have voiced to us. Another area, related to ARPA funding is our investment in diversity, equity, inclusion, and belonging, and our partnership with Georgetown University. Wanted to just let folks know, that shortly we'll be launching, two different, stakeholder engagement opportunities through our partnership with Georgetown. The first will be an opportunity for providers, to work with Georgetown. Georgetown will be hosting a series of town halls with, just specifically with providers to understand their, to get a better understanding of their work, in DEI. And then there will also be a companion, town hall series, stakeholder engagement with people with developmental disabilities and their families. Georgetown will use that, information to provide recommendations to us, to provide recommendations to our providers about how we can continue to, intentionally, bring, the principles of diversity, equity, inclusion, and belonging into all of the work that we do. So there will be continued, opportunity for people to participate there, and definitely more to come. We'll keep everybody posted. I think folks know that the public health emergency ended on November 11th, and with that, many of the temporary flexibilities that have been in place for the duration of the pandemic. So we're working with providers to make that transition as smooth as possible. If you have any concerns or questions, please, I think the first place to start with your care manager or with your local regional office contacts. But we believe that we're working to make sure that any of those flexibilities that were in place, that we're transitioning them out, and that providers are aware of all of those changes. I think the other thing just to mention is that our HCBS waiver amendment 14 was approved by CMS and took effect on October 1st. That approval adopted some of the flexibilities from the pandemic, ones that were really valuable, that we felt like really benefited the system and that we were able to adopt permanently. We did. It also includes modifications to the existing assistive technology program, and there will be additional information about that and home enabling supports and how we can begin to incorporate home enabling supports into the waiver. So we're excited about that. And it also includes a return to hard limits for assistive technology, vehicle modification, environmental modification services. That will take effect once the American Rescue Plan Act funds are fully exhausted. And it also raises funding thresholds for the approval of those modifications. So we're expecting to see what the attempt is to make it easier to access those modification services and more streamlined approach to how we do that work. We have okay. I think that's it. That's the extent of my updates. Happy to take any questions if folks have questions, or if there's something that I didn't address that you want to know about. If we have a couple minutes for that.
A couple questions we got in the DSPs. Are you doing exit interviews to find out why they're leaving? And the other piece with the DSP, have you looked at leadership, management for DSPs? Seems to have personal experience recently that the management seemed to be the issue with DSPs leaving. So if there's some kind of training and support for the leadership, I think that would be valuable.
Yeah, no, I think it's a great question. So on the exit surveys, obviously, we only have access to DSPs within the state operated system. I would assume that many of the voluntary providers are doing exit surveys when folks leave. I think, yes, we do conduct them, but honestly, I think the information that we get back from those is pretty sparse. We don't have a lot of control once a person has said they want to go, to then be like, well, before you go, do you mind doing this exit survey? It doesn't always, we don't always get that information back, and when we do, it's not necessarily the most helpful, but we are trying very much through existing, conversations with existing DSPs to understand what are those challenges, what might motivate a person to leave. A lot of times people can't leave because they need their job, right? But understanding what are those challenges so that we can address them before people are walking out the door. That's what, some of the work that we're trying to do now. We've done some focus groups regionally across the state operations is trying to pay specific attention to that issue. And then on the leadership issue in terms of management, I think state operations, again, and I can only speak for state operations, but state operations is taking a special, and I think, collaborating with our training department, which is under our division of administration, really trying to take a look at the ways that we're supporting managers within the residential especially, but within our state operated system. understanding that that transition from DSP to now I'm managing my peers, right? How do I do that? While also managers are asked to do both the management, the administrative work, and then oftentimes they're picking up shifts in the homes, right? So their job, they get triple the job sometimes, right? So really trying very hard to understand those challenges and support them in that way. And the work that I talked about with the National Alliance for Direct Support Professional, there are 3 different levels for our DSPs to take, and then we actually have a frontline supervisor training as well, and a curriculum that people can take through the National Alliance for Direct Support Professionals, so that frontline supervisors can get that support as well. And it's conversations we've had with NADHP, as we continue to develop a relationship and a partnership with them, they understand that that's a really specific focus area for us, is that management level. So it's a really great point.
Thank you. And just one other topic here with when you talk about CCOs, initially they were told they had to have iPads. And I guess out there now, the question is really the goal or the reason to have the iPad. How are they really doing maybe what they set out to do? I think there's kind of mixed messages and not a clear understanding. Individual, family, and advocacy board. Individual, family, and advocacy board.
Oh,
okay. The iPad. Yeah.
Thank you. It's a great question, and I don't know the answer to that, but we can talk with our CCO team and follow up to get you the information. I think obviously, right, family involvement and individuals who are receiving the services, having their involvement and their voice is really critical. And that's why I think we're so focused on the stakeholder engagement as part of our evaluation, but understanding, exactly how they're using those words at the CCOs is something that I don't necessarily answer, but we can bring it up with the CCOs. Sure, it's a great question.
Anybody else? Thank you, Commissioner. Alexis, next.
So actually, I think not next. We are going to switch it over to Fiscal to talk about the travel policy. Neil, are you on?
Yes, I am. Hi.
Hi.
Okay. Sir, hello, everyone. It's my pleasure to be with this group again. So I am Neil Mitchell. I'm the Director of Statewide Fiscal Services. I've been asked to just go over this travel policy for committee members we put together with you. This applies to the DDAC, the FSS committee, and the ASD board to be effective January 1st, 2024. And so I'll just let you know, if you have any questions, feel free to stop and ask. There will be time at the end. And also I'll tell you at the end as well how to sort of follow up with more specific concerns. Okay, so the purpose of the policy is to define how members of these groups are reimbursed for necessary travel. And one note to mention, which is referenced in the policy before getting more into the process, is that OPWDD asks people to attend at their nearest regional location when there is a multi-site event, or to seek pre-approval for travel to a central site if that's possible. So I think this is sort of the way you're doing things now. You'll see that much of this is just reflecting existing process, and we're basically putting some things in writing so that you know exactly where to go for the various resources. Okay, so let's talk a little bit, and this will be published to our website hopefully in the next couple days. So just kind of going over how the reimbursements work. We go by the travel manual published by the Office of the State Comptroller. Just a few points noted in the policy include that as a representative of this group, you're considered a non-salaried public officer. So consistent with OSC guidelines, you're thereby entitled to reimbursement for actual expenses incurred in the performance of your duties. And number 2 on this is OPWDD elects to rely on a receipted method for travel reimbursement just to ensure that any appropriate necessary and related expenses are reimbursed. That's as opposed to a set fee, which may not capture all of them. So going through the different Going through the different categories for reimbursement, and I just wanted to note we will provide links to all the rates mentioned in what I'm about to go over. For overnight travel, pre-approval is needed. Requests are asked to be submitted 30 days in advance. For lodging, we can reimburse up to the federal reimbursement rate based on county of lodging. Receipts are required for that. For meals, we go by the per diem rates by county. Reimbursement is based on the appropriate amount attributable to each meal defined by OSC. And we provide the link to those rates. This allows for reimbursement of dinner the day of the meeting and breakfast the following day. Now, there is some more detailed information about what hours things happen if you were, what hours you'd be entitled to the breakfast or the dinner at. So that's kind of more detail I won't go right now, but you'll see that contained in the policy. And then just also to mention for actual travel expenses, just cost of driving and things like that, these can be reimbursed with receipts. So that includes the cost of traveling to a bus station or train station from home if necessary. And it also includes tolls. We can reimburse mileage per OSC rates, and that rate is all inclusive of gasoline, wear and tear, etc. So we'll provide links to all of the rate information I just noted in the policy. And if you have questions, feel free to reach out through the DDAC liaison, and we'll be happy to provide answers. So like I said too, that will be coming out for you to see in the next couple days. All right, thank you.
I have a quick question. You mentioned driving expenses. What about train or other means? I mean, I'm only thinking train, but.
Yes, sure, yes. A train would be inclusive of that, of what I would describe as travel expenses. I did not mention specifically, yes, the train would be included.
What about the turnaround time once this stuff is submitted?
Oh, well, hi, Mary.
Hi, how are you?
I'm very good, thank you. We'll just try to do it as quickly as we can. You know, if you ever have an issue with that, feel free to reach out to the FSS liaison. It's probably the easiest way for you to get to me, and they'll get that to me right away, and we can follow up on things for you if there's ever an issue. But we aim to turn that around as fast as possible.
This is Deborah Gripe. I have a question too.
Deborah, Kevin's going to answer also to Mary's question.
Okay.
Thank you, Kevin. Yeah, I mean, I think, by having a policy, I think that'll allow for a lot more streamlined approval, right? Right now, I think we've got receipts, non-receipts, there's different ways that I know. When Josie was here, she was struggling to try to review and process, those, and then had to determine what is appropriate for where the hotel stay was, for example. So this policy is really, as Neil said, it's from the Office of State Controller as it relates to, travel reimbursement policies for non-state employees. And that's what we want to advocate here. So I think the benefit of having a consistent approach is that it should streamline approval, right? There may be some difference initially, as we all get accustomed to receipts and things like that, but I think my hope is that gone are the days of multiple months of waiting for reimbursement after request for.
Thank you, Kevin. Deb, and then.
Okay, the question I have is, you said also I understand for the overnight for the hotel and also for the train. What happens if you don't have the means to put out the money? Can you do a 30-day in advance? What forms are needed for that?
That is something I would ask that we follow up on. I'm speaking more to the policy kind of around these things as opposed to that kind of mechanism. But it's something we can, follow up on for you on, if that's okay.
And I think part of that, Neil, would be that if we're talking about trains and overnight, that may not actually even be the closest venue for somebody. So that type of travel and overnight may not even be necessary based on a new policy.
That's an excellent point. Thank you.
Alexis, could you really explain what you just said? I didn't catch all of it. Thank you.
Yeah, so I think when the policy is posted on the website, it will make more sense. But one of the biggest changes here is making sure that everybody is going to the closest site to where you live. So there's a site in New York City, there's a site in Buffalo, in Syracuse. So whichever, and obviously Albany. So whichever one is closest to you is what you would be going to. So that is just a cost savings perspective and why we're using the same type of policy that we use for our own travel and reimbursement.
Okay, also you take, if this includes like for a person with, like right now I use mobility device to get around. So if I had to go to say a different site, I have to use Accessori to get to the other site, you would work something out with me? Or we can discuss this offline.
Yeah, let's talk about it offline. And just to clarify, if anybody has any questions, it's not your local regional office. It will be our central office mailbox so that we can coordinate with Fiscal and ensure that we have all the answers to your questions and we're able to process.
Thank you.
Well, I'm sorry, I just have a quick question. At the DDAG meeting, I believe I saw a Long Island site. Is it going to be a Long Island site available for?
We'll follow up on that.
Thanks.
Thanks, Rachel.
Okay, we have Chris and then we have Mary. Oh, Mary. Chris?
Thanks, Kathy. Yeah, so my question is on the closest venue policy that you're describing now. As I sit here remotely, of course, and I think you'd agree that there's really nothing like what you can accomplish when you're live face to face and working on issues that are important to the community, right? That face to face interaction experience, I think, is really optimal. So if I'm understanding the policy correctly, someone like me who lives, in Rochester would currently maybe go to Buffalo as a requirement for, how you want to manage this. Never, going to Albany to have that kind of face-to-face interaction that I think is most effective. So I'm wondering if there's exception to that policy or what kind of workaround to that policy and kind of the origin of that policy. I guess I was curious about that. That would be my first question.
Sure. This is in no way meant to be a hindrance, and I should point out that there is flexibility. I briefly mentioned this, but I only mentioned it once. That you can request travel. So with 30 days advance notice, we request. But and I think that the group, perhaps members of the group or the group working together, could kind of determine what would sort of be an imperative there. We would need to justify it, basically because money is being, is spent. But really the origin of it is, we've created a lot of internal policies to try to just put into writing some more sort of almost like compliance points. Like these are areas that we can reimburse you for. So we definitely should know the full range of what we can reimburse for in terms of expenses. And also just sort of what all the correct rates are, the process sort of works, in a broad outline, just so that we're all on the same page. And these are all the rules that we have to follow as well, as state employees, and it's sort of reflective of the fact that you're all public officers and it's public money.
Understood.
Okay,
thank you.
Yes, my name is Becky Wire. I also just kind of want to piggyback on what Chris said. I think it's been almost 4 years since this pandemic. I think that we had a lot of access to Zoom and remote meetings, but I honestly feel we have a lot more productive meetings when we are in person, when I can actually see the faces of people when I ask the question, which I can't see anybody on the screen there. I think there's a lot of money saved on these remote meetings. And I just like to see the world go back to where it was. I really would like to see people put in effort to come together to solve common problems and to work out the best solutions. So
I mean, I literally came up from New York City this morning because I would rather be here than walk over to Seventh Avenue and do this remotely, you know.
Right. Yeah, and I guess if I could just tack on to that, and I'm sorry, trying to understand, is there a justification that's been developed that would say this is what the criteria you would need to meet if instead of me going to Buffalo for the next meeting, I wanted to, go to Albany and, shake the commissioner's hand and be able to be there in person with her? Is there some guidelines that are established for that, or how is that going to be decided?
And there is no, sorry, I'm not sure if anyone wanted to answer before me.
Go ahead, Gil.
Yeah, I don't think that there's any specific guidance of that nature, and it kind of goes back to that word necessary. It's what's determined necessary. So, I think the history of us, of OPWDD working with this committee is we really try to collaborate with you. So where you determine, a priority for, say, overnight travel or in-person travel, we're happy to work with you on that. I think that's a discussion that you can have. And really what we're just trying to do with this is lay out some of the basics. But like I said, there's sort of that exception built into it. And if you have comments, we issue the policy, like I said, is, a matter of just sort of like a good government and trying to have these things, written down and helping you to follow them as well. But we're always happy to accept feedback and make modifications to those aspects which we can, feasibly. It does impact groups, so, we just have to make sure we have one consistent policy for all three groups. But, I certainly don't think, I wouldn't want this to be interpreted as, reflecting on the, trying to sort of get in the way of what you're describing, this coming together. And, we certainly respect the importance of this group and the work that you do.
Great, I appreciate that.
What? I also would like to mention that I also agree with Mary and Chris. Being here for so many years, you really do develop a relationship, and that relationship is really important so that we learn about each other's area and need. You lose that if we're all over. So, I mean, even you have 7 today here in Albany. We have poor Karen by herself in Buffalo. You need to have a conversation, a side conversation later on during lunch. What did you think about that? I would like this travel policy that's going to be in effect, if you can consider the importance of us being together at these meetings. It's hard to get there. We get many people who couldn't even leave their house because who had an emergency, had to drop out. So this is great that we have the flexibility. But I remember the day sitting in the commissioner's office and was in public meetings, and it was really important that we got together and learned about each area of the state, because we are very different. Anybody else?
I agree. If we are looking for an exception, is there a process?
At this point, I would just need to request anything through your liaison, your general liaison for this committee. And that would sort of begin a review process. But, also do take a look at it. It's not up yet, but do just sort of look. And if you have a reaction to it, feel free to provide us feedback. I've kind of gone over it in broad detail, so it might help you also once you've seen it. But like I said, we're happy to work with you on it.
Yeah, I think, just to clarify, I think it would be helpful to send it up to the central mailbox, because this is a new policy that we're rolling out to be consistent. So if you guys all have a request, what you think is compelling, or a request to, like, just as Kathy said, I was just said to be in person, just send that in. I think we'll post the policy as Neil said, and we'll welcome, any feedback too, right? We still have a month or so before it would take effect. So if there's something else that we want to redefine that would be more strict, right? I think the point is state controller kind of governs how we're really supposed to be able to use public funds. And so the use of the term when necessary is very subjective, right? And so I think that as long as we have some general parameters, that's fine, and we can work through that. What we want to do is get a framework of a policy out there to know minimally how much we're going to be reimbursing that. If we decide to take the personal vehicle, if we're going to do overnight, day trip only, you know, what we might, we've had requests about getting meal allowances. Sorry, I'm not talking into the thing. Sorry. Thank you, Commissioner. So the goal was really just to ensure that we had a consistent, you know, like rate of payment based on the location that you're traveling to, not traveling from, right? And so that's what this policy is intended to do. So just to restate, because I felt like I did wander off a little bit, like we, you know, if you have feedback or something, just, you know, please provide the feedback once you see it through the central office mailbox. Alexis's team can, you know, bring that together and share that with us, and we can work and evaluate, you know, an amend is necessary. So about, you know, 5 weeks or so before this would take effect. And, you know, I think we welcome all feedback on that, but I think necessary is pretty open-ended.
Just the other thing that I want to add is that, you know, we, in response to people requesting multiple locations, right, we go to great lengths every month, every quarter to make sure that we have multiple locations that we're, you know, in some cases, we're paying for those multiple locations, the technology, the efforts that it takes to connect those multiple locations, right? So, you know, there's the trade-off there, right? If we're going to those lengths to create those multiple locations and nobody's coming, right, where are we gonna stop doing that? And people are gonna come to Albany, but then what happens is that people don't always come, right? And we don't have those multiple locations available. So I just think too, in terms of, you know, how business is going to get done and how we make sure that we have the right infrastructure for business to get done. And it's the same, right, as folks have mentioned, it's the same thing that we're trying to consider for the DDAC as well, and trying to really mirror with our public meetings in the Autism Advisory Board, you know, how we're approaching this with our public meetings. We have to figure out where is the places that we're investing the budgets that we have to facilitate these meetings. So I think as you guys are thinking about that and reading the policy, I also think just keeping that in the back of your mind is important.
Thank you. Okay, now we have that family support liaison, Nick Hobson, to discuss program updates and information.
Preparing call or staff stuff. That's definitely program liaison, however it might be statewide email. That's us. That's funny. I'm including Amy in that.
Excuse me, I'm sorry, but Nick, if that's your speaking, we can't completely hear you going in and out. Sorry to interrupt, but I want to hear you.
Does that sound better? I'm trying not to have it like I too much.
Yes, that's better. Thank you.
Thank you. Can you just advance to the next slide? Thanks. So without further ado, we're starting with some of the updates from the September meeting, which I'm sure everyone recalls. One thing we discussed and we've been working on since then is information gathering for all of you. So we have, with the help of the regional office staff, collected comprehensive contract info for all of the FSS contracts statewide. So some of the things that information includes are different program types, the values of those contracts, utilization rates, and other things that will all help all of you to do the work that we asked you to do. We are still in the process of organizing that information, and it will be provided to all of you at some point. We're looking at providing that on a quarterly basis. So we're working internally to finalize that information, and once it's available, it will be coming your way, and everyone's anxiously anticipating that. Alexis, did you have something you wanted to say?
Oh, yes, I just wanted to add to your update. So the compilation of the comprehensive contract information was something that we've heard from you as a helpful tool related to reallocating for future RFPs. So let's put that 3.5 to the side for a second and just think about this long-term process based on, you know, subject to funds being available within your area and within those contracts. Just a reminder that as part of that process of looking at reallocating and evaluating programs, you do need to be a formal member of your local council. And what we have included in our statewide bylaws is that in order to be considered a formal member, you do need to have a conflict of interest signed and on file. So I believe that there was a comment this morning about some of the areas of the state without conflicts of interest on file. And, you know, to be compliant with the bylaws, that conflict of interest does need to be signed. So I would just encourage the committee, if there are pockets that are missing conflicts of interest, or you don't have areas of the state represented, you may need to have a conversation about consolidating committees. But you know, I don't want this to hold you all up in your process that you're developing, you know, the needs assessment. You really do need to make sure that those conflicts of interest are on file, and all of those who are sitting around the table are formal members contributing.
I have a question. I may have missed it. Did you give us a target date when things will be organized and disseminated to us?
No, not officially, but I mean, like I said, we want to make sure that the information we give you is correct, accurate, in a usable form, all of those things, otherwise it's not going to be very effective to all of you. So I do appreciate everyone's patience on this, but once we do have this set up properly, we'll be providing you, we're looking at quarterly updates to that information. So you'll be able to have that at those time intervals to help you with all of the contract related, program related work that you all are doing. You advance to the next slide. Oh, sorry.
I have a question. It has to do with the COIs. Are they going to be in the calendar year? The original signed or the calendar, date? That was one question. The other part is there some provision that if things change in your life as a council member and you're connected with other providers, are you required to revise to an updated COI at that point?
And could you explain what, I mean, like you're part of the council right now? You're saying if you move to another council?
No, part of it is, if we sign them, I guess, in June or July, are they going to be re-signed a new one each year? And is it based on a calendar year or when you signed it? That's one part. The other part is, if as a family member, I'm connected to this one agency and I decide to add another agency, then am I required to do a revised COI at that point in time and not wait till the next period of time?
This is Eileen Haynes, the general counsel. So the conflict of interest forms are usually done every year and they're updated every year. Whether that's done, you know, I think each council can decide what time they are doing it, and their bylaws might have that information. But if something changes during the year, you should update your conflict of interest. So if you change employers and you're no longer, we're working for one provider and you're now working for another provider, or if something, some other event happens that may create a conflict for your voting, then you should update that in the interim.
Thank you.
Any other quick points on that before I continue?
I think we're good.
So the next piece, some of the updates and work around the family reimbursement ADM. So based on stakeholder feedback, and that's coming from all the various sources that we've received, that the allowable, non-allowable lists are being revisited. Gail mentioned earlier, the list that she shared with all of us. And we also have information that we've gathered from the provider surveys that we've done, which I'll get to on another slide here, but we're currently, the way I framed it is crosswalking all of those various lists. So we have what we've received from the surveys, we have what we received from Gail, and we've also, we've had, the last time it was updated, the list was in March, so we've had 7 or 8 months of other areas where we've received information regarding the list. So we're taking all of that and moving that forward for review. So once again, I'm not going to promise any dates on when that's going to be on the website, but we are taking all those into consideration and making an updated list. In addition, going back to the training that was provided in May, we have made updates to the FAQs that are on the website. Right now, they're currently under review, senior leadership, but we have, I think, made at least 5 or 6 additional questions and answers available on that document. So I'm not going to speak to specifics because it's still in review, but once again, that's something that's also forthcoming based on that training / informational session we did a few months back. Can we move on to the next slide? Once Alexis has something else to say.
Sorry, one more thing I just wanted to add in there, is that while we're reviewing the things for reconsideration or for consideration to be on the allowable, if they're not even on the non-allowable list yet, is we know that there are some things that are available through Medicaid and have a process to get something sooner than when you would typically be able to receive that. An example of that is glasses. So as we compile some additional resources, whether we're, adding something to the allowable or saying, no, this actually can't be allowable because of X, Y, and Z, we're trying to compile some supplemental resources as to what the X, Y, and Z is, so that that can serve as a tool for the care managers and family members navigating the system to access those, the ways that it is available. So more to come on that, but it's a partnership that we're working with the waiver team.
Move on to the next slide, please. So in addition to all those other things, we are continuing to gather information and collaborate with the ROs to learn more about processes that you are involved with them, including things around annual satisfaction surveys, contract reviews, site visits. So I know, obviously it's of interest to this group to understand how those relationships work. So I think everyone's heard me say things similar to this before, but as we dig into anything that anyone is doing, whether it's the councils or our own regional office staff, there's always variation between how those things are done. So it's important for us to understand that. And so I know it seems like it may be a lengthy process when we're digging into these things, but it's so we can completely understand how things are being done and what makes sense in terms of from a guidance standpoint, so we can make those things run more smoothly, be a little bit more consistent. In addition, we're revisiting those guidelines around all of those things. Like I said, to make things run more smoothly, to increase transparency, and to make it so all of you, can participate in them as much as possible. We know that we depend on the members of this group of the local councils to help with that program review and that oversight. And it's imperative that everyone understands what that role is, the relationship is between all of you and the regional office staff that are involved with making sure all of those things are done properly.
I have a question. The site visit protocols, there was a time when we would do on-site visits. practical way of doing a visit, but we are still doing virtual site visits. Will we be moving to on-site site visits?
I think that's one of the things we're trying to look into. We've been trying to align a bit of what like DQI is doing when they were doing virtual and when they switched to in person, but that's one of the things we're looking into. So we'd love to go back there because that's obviously what makes the most sense, but we'll get that guidance when we issue that as a package.
And
As far as program reviews, and maybe I missed it in process here. Are you looking at, that all programs are going to be reviewed by council members or just ones that are struggling?
I mean, I would see it as they wouldn't just focus on ones that are struggling. I mean, is there a reason? I guess I'm curious, is that a reasoning behind that question exactly?
Yes, there is, but that's kind of way we're pursuing business at this point, that they're looking at the ones that have the staffing time, whatever, just looking at programs that are not meeting their outcomes. And I know in the past, historically, when we did them all, we found things that we weren't aware of, in that process, because you could get asked questions and dig a little deeper.
So it really should be all. But I think when we kind of get there, we can talk about it further, to your point about the bandwidth. In the event that there needs to be a priority, we can talk about that, but every agency should really be getting these evaluations.
I had a question about the satisfaction surveys, because back in the day, they used to be shared with the local councils. Is there going to be a mechanism in place? I understand that surveys have gone out to the providers and the responses are being collected. Are they being shared with the local councils? They had been in the past.
Well, you would know right now better than we would if they're being shared with you.
Well, so I guess they're not being shared in my area, so that's why I'm raising the issue.
Well, I think we have
Unless they haven't been returned yet, but I thought they were returned.
I think when we're doing evaluation, program evaluations, virtually, it's hard to see the pile of satisfaction surveys. And I have not had one agency mail them to me. So, I mean, that's the importance of getting together again and collaborating as a group of people in the same room, evaluating, these contracts to see if they are being utilized, what can we do to improve them? Family reimbursement, it is, you don't really need us because there's not a lot of applications going in. What used to take a 2.5 hour eval of going through the applications and process is taking under.
And we haven't been able to do quarterly contract reviews since we went virtual because it's just not working.
Oh, I'm gonna go back to something I just said a few minutes ago. This is the point about the wide variation on some of these things. I think this is a good example because it's not the first time that I've heard how differently regions or districts even deal with how surveys are done, who's sending them to who, what results they're seeing. So I think on this point, it's helpful on our end to maybe we need to. I'm kind of looking at Kale and Kathy when I say this, kind of getting some more information about that process from your end as well. It's definitely, I've gotten more information from the RO end, but I think if that's something, that's a request I'm gonna make. I guess that there's value in the surveys, there's a reason why it's done, and it's something that should help inform decisions.
And actually on the bottom of the surveys, it says, or it is supposed to say, would you like someone from Family Support Services to reach out to you? And that's a great way for us to get more members. Like, let's reach out to them, let's call them, that's at the bottom of the thing. So we should be, really looking forward to these, because this is the way for us to help families. I mean, I thought one of the best ways to help families was be at the front door meeting and saying, hey, here we are, we're the Family Support Advisory Council. Every family has one. You know what? Reach out to us, you know? What I learned from another parent. You know, this road is travelable. We'll meet nice people on this road, but we're here to help you, you know, and people need help, you know?
I completely agree with that sentiment, so. I know I only have.
Excuse me, Nick, can I just make one?
Of course.
I just wanted to say, I know in the years before COVID, we used to do our own survey and send out to different people, but then there was conflict about HIPAA. But we used to, give it to the agency and have the agency had to send it out to the families. And we provided the return address to come to us. We had that. And that's something maybe we should look into again.
I know for a fact that's one of the variations about who the surveys get sent back to. So, and I hope everyone is aware there is one survey that was developed last year. I think we put that together with a work group that's on the website, so there should be that one survey as the one used as the family satisfaction survey. We did a lot of consolidation with the fact that there were multiple surveys for every single program. All right. I'm seeing nodding, so it makes me feel like someone that was out there. All right. I know I only have a few minutes before we have the final part of the meeting, so I'm gonna move on to the next slide. Thank you. So going back to the provider survey that we administered in October, we put out that survey to all of the FSS family reimbursement providers. In total, we've sent out 173 surveys. That's not exactly 173 providers. That's some of those surveys went to multiple people at the same provider. I think it was about, Amy can tell me, 116 providers roughly that covered. We received 46 responses out of that, and we are in the review and analysis period of that survey currently. So obviously that's another thing that once we have concrete finalized results, we're going to provide to everyone. And one piece which I mentioned is, not to anyone's surprise, you know, a lot of those surveys did mention different ideas on what should be either allowed or things that are currently not allowed that should be allowed. So that's all being taken into consideration as we update and review things. I think I have one more slide. And as I just said, I was not in my thought considerations being given to the need of some additional instruction documents. It's a little bit of a separate note, but one of the things that have come out of the surveys, and I think from this group prior to doing those surveys, is you know, better instructions on things like we're hearing it on the application, and also around some of the clinical justification pieces that you talked about earlier today. So those are all things that are under works being considered in terms of making things more useful and helpful in people. You know, we want everybody to be able to understand what's needed when we're asking for these various documents. And I think actually that was all that I had. We may have a couple minutes before we have to move to the next thing. Any quick questions before we move to the public comment period?
On a second, I just have a question about this last slide.
Oh, I skipped my last slide today. There we go, there's my 2 minutes, so you don't know. There's no questions. All right, so the FSF number information, so and this is actually an actual update that we can come back with something for you. We, were notified that, and this applies to the DDAP and the, autism spectrum disorder board, that, we needed to have member information on our website. At this point, actually, just today officially, and we'll make sure we get the link to Kathy and Gail so they can share it out. We have updated statewide committee member information on the FSS webpage, so that's exciting. And we have, as a point of contact, we have the FSS statewide shared email, so that's going to your statewide liaison here. And it's really not, it's a limited amount of information. It shows the name, it shows the county of residence, how they were appointed, which anyone in this case would be through the commissioner's office. And an affiliation, it honestly says family member or family advocate for pretty much everyone. So, but that was the format they used for DDAP members and the Autism Spectrum Board. So we kept that same format. But like I said, following this meeting, we'll get the link out so you can see what that looks like, make sure it's accurate. And they also archived the, I think, last 3 years of the statewide committee meetings. So there's an easier link to get to all the previous meeting recordings, which I think is helpful. So anyway, we will get that out to everyone. And if there's anything that doesn't look right, please let us know. Thanks.
Any questions?
Yeah, Kathy, this is Mary. I'm trying to keep track of time, but we've used it all up just on this, and we still have all those other items.
And we have public session.
No, we're done, Mary.
So that,
Nick's talked about all those points
all
under.
right, okay, all right, but time's up then.
That's why we have hired you, Mary.
You just want me out front to take the bullets, I know.
That's okay, Mary. I'll help take the bullet with you.
All right, so with that, we're going to start public comment. And just as a reminder, public comment period is for anybody to come forward and state a concern. You may have a question, please. This is not the body or the forum that you will be getting answers. So with that, we're going to have Rachel. Well, we could start here in Albany. And we don't have anybody here. I don't think there's anyone in Buffalo. No.
Yes, we do have one person here in Buffalo.
Oh, good. Did you want to make a public comment? You don't have to.
Yes, thank you.
No.
My name is Ed Fryer. I have my wife Valerie Fryer. We sit on the Region 1 FSS Advisory Council. We have an 18-year-old Tier 4 severely intellectually disabled child that we like consideration of reconsidering the ADM consideration that would pull the pull-ups and wipes from consideration from FSS reimbursement. And I'll give you my personal story on behalf of that. And the premise behind that was saying that they would be covered under Medicaid. Again, my son is going to be 19 in February. He is not toilet trained at all. We use the pull-ups and wipes every day for his needs. We used to have a prescription, again, documentation through our physician that his incontinence is based upon his intellectual disability. And we used to be able to get a prescription filled through Rite Aid for a prescription. I'll use the name brand as Depends. We used. At that time, Rite Aid had shut us down and said that they could, Medicaid was no longer reimbursing there. We went out to the Medicaid route. And again, this is over a number of years in the past. We went down to the Medicaid route and we would receive the Medicaid pull-ups in. They were inferior products. They were so inferior that they would have to include a booster or like a Kotex to absorb the urine on there. He was experiencing severe we'd have to get creams and ointments because of the way the pull-ups the rubberized would fit between the legs. And we were getting severe rashes from that. At that time, we were not getting pampered. We were not getting the wipes from Medicaid. We were purchasing the Pampers wipes, and they were reimbursed under FSS. At that time, then we couldn't do that any longer. We found another pharmacy, CVS, which would fill it under prescription, the physician had to write a very specific prescription for that, and we would get the Depend pull-ups. This goes back about, I'd say maybe 4 years ago, 3 years ago. At that time, CVS shut us down. Medicaid would not reimburse for Depends anymore. We are now to the point where we were getting reimbursed. Again, I go through about $1,000 a year in Depend pull-ups and Pampers wipes. I have to get sensitive wipes because he has severe reactions to different things. So now we were being reimbursed under the family reimbursement under FSS until the ADM of last year, which was pulled. There was no more pull-ups and wipes that were being paid for out of that. And again, the premise to go back to Medicaid to reimburse that. The Medicaid wipes are very, I have a 220-pound individual that I change on the floor. The wipes are glorified paper towels that I have to wet to change him. And I can't use that at all. It doesn't help me. I could get documentation from the physician that I use many different kinds of Medicaid pull-ups. And I find I always have to come back to the Depends. And right now, I'm still purchasing them. Again, I can't get reimbursed anywhere under my budget, under the OTPS category. I'm exhausted. I do have a line item on my budget to pay for FSS items. There is money there in my budget to pay for that. I can't get them reimbursed. And right now I am basically private paying for these pull-ups and wipes that he needs on a daily basis. And I'm asking you to reconsider to allow, and again, I have no problem with getting physician documentation that this is incontinence due to his disability. And I have no problem with getting any kind of documentation that is needed, but reconsider to put that in as a considerable item under the FSS family reimbursement.
Thank you. Is there any members of the public in New York City that would like to comment?
No, nobody here wants, we're fine. Thank you.
Thank you.
You're welcome.
All right, if you are online and you would like to comment, please raise your hand. There's a little raise your hand button at the bottom of your screen. I'll give folks a minute to raise their hands. Okay, first up, we have Jacqueline. You should be getting a request to lower your hand, so. Or there you go, Jacqueline, you should be unmuted. Okay, next we have Ralph. Ralph, you should be getting a request to unmute. And you're unmuted.
You guys hear me?
You can.
Okay, great, thank you. Well, I always try to acknowledge a previous speaker. I've heard similar problems. Obviously, I don't have time to comment on other things people have said, but you know, that's a common thing that people have run into trouble with and need a solution for. So I put a comment in the chat, if that's the chat earlier, and really don't want to take time on it other than to say it's kind of a common problem. So the problem is that the survey, you know, I'm not criticizing OPW staff. It seemed like the comment to the concern someone in New York City raised about transportation needs no longer be available once someone is not able to use the waiver option, able to be eligible for waiver services, and those sorts of problems. You know, doing a needs analysis to solve that from the standpoint of the survey, excellent survey that the council, and I should say this first of all, I forgot, sorry. I am a self-advocate. I've been involved with advocacy for a lot of years on the Family Support Council on Long Island for maybe like 6 years. So, you know, I worked previously in disability services research, so some of my comments are from that perspective. So in a nutshell, the way to helpfully get an answer to the transportation needs of people that no longer would have eligibility for the waiver, it has to be done through the CCOs with a purposive sample, a way to look at those people that are specific for that, because you're not likely to reach the people that would have that need on a general survey methodology that was talked about previously. Second point, very important, about 2 months ago on a general Medicaid advocates meeting for New York State advocates, came to my attention, and some other advocates, I'm not working on this, others in IDD advocacy are working on it. If you go to the New York State, Western New York State Legal Center website, I can send the URL around later. There is a clear requirement under the ARPA funds that New York State has accepted to basically stop a change in the eligibility access for HCBS waiver services until the ARPA funds are exhausted. Again, that's an important point of information. But then, you know, I've heard this in a couple contexts, so I don't want to say it's one OPWD staff person. I've heard it from other advocates that have said that the criteria for eligibility for children, that's come up in the meeting here today, for children that are school-aged, that they are not seen to need the waiver because they don't have foundational skills. Again, this is a problem of almost like rumoring, perhaps. There needs to be a clear reference to a reason, such as a term like that. It's not supported in the literature, either publicly available stuff on blogs, et cetera, or the scientific literature that I found that says foundational skills are a requirement before you would even start rehabilitation services. So if someone could please provide that to us, not just me, the references in the ADM and guidance on eligibility for the waiver and community rehabilitation, that would be very helpful. I've said a lot, and there may not be other people to speak, but I don't want to take up too much time. I'll stop there. I appreciate all your effort. I appreciate hearing the other people on the councils in the rest of the state, and thank you.
Thank you, Bill. Next up, we have Jacqueline. You should have gotten a request to unmute, and you're unmuted.
Can you hear me?
I can, yep.
Oh, good, because you couldn't hear me before. My name is Jacqueline Tripodi. First and foremost, I'm the parent of a multiply disabled young man who recently turned 30 years old. I also work for a family support agency that provides family reimbursement for 5 counties. The respite reimbursement that Kathy Nowak referenced earlier, that families with young children are not getting the respite waiver from 3 to 8. We're starting to get requests at our agency for reimbursement, respite reimbursement, and we cannot do that in our agency. We can only do emergency respite. There needs to be some more thought into how those families are going to get served if they're not getting enrolled into the waiver services, and how we can assist these families with those respite needs. The other thing I'd like to touch on is the CDPAP, the families who have CDPAP in the single parent household, and they are struggling. Yes, they are getting CDPAP. They used to be able to get family support reimbursement for the additional costs that their children are incurring due to their disability. We are doing them a true disservice by not helping them in other ways. There is a disparity in counties. There are some counties that families can pay for the horseback riding and swimming lessons, and then there are counties where some families cannot, and we can't help them. Their needs for mattresses or beds, but we can't pay for those, but we can't pay for the mattress covers either. Let's help them out. Let's really rethink that. I think we need to be very clear in understanding what the needs of these individuals are. The noise canceling headphones is a game changer for so many young people with a diagnosis of autism and having them get through their day. Parents don't just want to buy them beats. They want to give their children a fair share to be out in the community without having a meltdown. And if we have family support systems that can help them, we would very much like to do that. I want to finish by the request in the tracker where we have to indicate how this is keeping this family member home with the family. As an agency, it is intrusive for us to ask that family question. It is often, pushed back when we do ask, but we do have to put that on the tracker. So we need to really think how we can approach that to be respectful of the family's privacy for that alone. And CCOs to have turnkey training for the care managers to understand what they need to have in their life plan, because the OPWDD is asking for us to have that information in the tracker. We need to have the communication clear and straightforward. I appreciate the time to speak, and I hope you all have a nice holiday.
Thank you. Next up, we have Catherine. Catherine, you just got a request to unmute, and you were unmuted.
Very much for allowing comment. I had heard an earlier speaker, and I apologize. I think some of us are, of course, multitasking and listening to all the important information. I'm an FSS provider, and I had heard, and I'm sorry, I'm not sure who it was because you're in the conference room there, mentioned that the survey, one of the surveys that had been developed by the council was posted on the website, and we have historical surveys, and we use our own surveys, and surveying is, part of our contract, and it's a great practice, and it gives us all kinds of information, but it's so hard to find. I say this as someone who's pretty tech savvy, and I know this is not the council's mandate, but the website is just very, very hard to even direct families to. So if you could, if we could put a link to the survey or tell us where to find it. And I understand this is not a place to ask questions, but it would be much appreciated. And then also, if possible, one of the things I would say as a provider is that our service, and it's an excellent point that, all these different programs have different surveys, and we need to have some consistency across programs. And of course, our FSS councils need to have insight into that. And they do, and we really value them having that so that we can have a substantive dialogue. But also just as a provider, it is so important for us to have the direct information from families, because I know for education advocacy, we absolutely tailor our service around as much as possible what families need and want. And in a changing environment, during, before, after COVID, and everything else, we really need and want to be responsive to our families' needs, especially where we see trends. So I would just ask that providers maintain that ability to always see what our families are directly needing and wanting. And of course, there's nothing about any other survey that's used that would prevent us from surveying families in addition, but also there does become a significant administrative burden, I would say, to lots of additional tasks. But again, it's a wonderful feedback mechanism. And so to the extent possible that we can make it meaningful and still get good granular information, that's much appreciated. But if you could just let us know where on the website some of the information is being posted. And one final request would just be to update the website with the slides from the FSS meetings. I know that the last slides that were updated are from last October 2022. So if it's possible to just keep the pages updated, that would be great. And that brochure that was put together and was previewed earlier today is so awesome. We cannot wait. I cannot wait to tell more families about our wonderful family support advisory councils and get them interested and engaged, because again, the work you do is why we do what we do. So thanks.
Thank you. You have one more hand up. Rick, you should have just gotten a request to unmute.
I just got an automatic message come back. Okay, I trust that all is well. Thank you for the opportunity to talk and for this public presentation from FSS. There are a bunch of things on my mind, but I want to keep it focused to family support services. I want to urgently, I can't think of a strong enough term, urgently second the comments from the gentleman that mentioned about the need for personal hygiene products for his son. I should have said up front, I am a fiscal intermediary coordinator in the Finger Lakes area of Region 1, and I also sit in on the FSS review team at the local agency here in Rochester. Like I said, I want to say that there's a lot that people need, that family needs. I've seen this as a care coordinator and broker and now FI, that with the changes to FSS and family reimbursements have made it significantly more difficult for families. My other thought and comment is we need information. I understand to make some updates, but I feel like we are doing nothing but surveys and nothing else is happening, and there is no forward momentum. It's just, let's look about this, let's talk about this, but nothing occurs, and that becomes very frustrating out here in the field. We have, I don't know what the other regions are like or other agencies. Normally, the FSS provider agencies are out of funds by July, August, September. This year, we can't seem to use the funds that were allocated because of the difficulties that have occurred through family reimbursement. And even when we try and meet the requirements, for example, somebody who is going through startup for self-direction does not have a budget, is being rejected for respite. And that is a problem. And I just, there's a lot of broken issues in various aspects of the OPWDD system, it seems right now. And talking about it is wonderful, but it doesn't do anything if we don't make any changes. Thank you very much.
Thank you, Rick. There are no more hands raised.
If I could just ask Catherine, if you can just put your question into the chat or just ask for website link to the application or the survey, I'd like to just send it to you. Otherwise, because of the Q&A function, I can't blast it out to everyone broadly. So if you can just throw that into the question, I can send that link to you. Thank you.
I just wanted to make sure that we're clear about what survey she was asking for, since we've used that term potentially for the town hall survey that was mentioned earlier, as well as the survey that we're developing. And our survey from FSS is not going to be, or isn't currently on the website, but the town hall was just blasted out this morning, I think. So I'm not sure which survey she's referring to. I just want to be clear.
So let me just clarify what I heard, because we're not doing a dialogue. However, she was kind of piggybacking off of what Nick was talking about, which was the survey that was developed with the committee as part of the FSS Family Reimbursement ADM. And it is actually an attachment to the ADM. So I did just send the general link to the landing page, but as soon as I get off the mic, I'm going to send you the link to the survey landing page.
So that concludes the public comment, but we have a couple of comments here in this room. Jan?
Open actually, but when I first came on this committee, one of the first things I did is I went to the YouTube videos of the prior meetings, and this whole frustration and difficulty that families experience with a person with such severe incontinence just echoes every single time there's a public comment period. Voluntary providers, state providers have to also use those same incontinence products. Are they experiencing the same frustration, or they're just not voicing it? But it just seems like this is something at this level of OPWDD that maybe they could help reach out to CMS to resolve some of that.
Yeah, I think it's a great question, and we actually did have a conversation because our state operated programs use the same Medicaid reimbursable products. And we didn't have the same feedback from our state operated staff. But that being said, you're right that it's something that has been voiced several meetings in a row. We have had conversations with the Medicaid program about the reimbursable products. We'll continue to do that. And obviously, as everyone's talked about, we're continuing to evaluate the family reimbursement portion of FSS through the survey and all the other tools that I've been talking about today. So it's not that we're not hearing it, we're hearing it, we're having conversations. And I think evaluating that piece of the program altogether, but just not as a one-off on one product or one request.
This is a little bit off topic, but same issue. It just seems like the people who have significant health and medical needs, multiply handicapped people are getting the most. Mary and I are on the SOS group, which I know you're aware of, and we have a durable medical equipment provider who's ready to close the schools after generations in the business, because Medicaid, I don't even think they pay enough. Medicaid just doesn't pay enough. And these families are desperate. Is there any discussion, including that durable medical equipment?
Yeah, I know that we've had conversations with the Medicaid team, the policy team, at the Medicaid office, about specifically about DME.
I raised my hand.
That people are having. So again, right, I think, your advocacy and information that you provide to us is really helpful. We have those conversations with our partners. And even, your direct advocacy of those offices is also, welcome. And you have the right to do that. But it is, we do bring these challenges that we hear with Medicaid
Leah is trying to raise her hand. They won't let her. Hi, it's Deborah Greif. I want to comment on.
Deborah, the commissioner is speaking at the moment.
Sorry.
I'm done. Go ahead, Deb.
In reference with the diaper and the durable medical equipment, State Senator Roxanne Prasad, who is the chair of the HRA committee in the state senate, has asked people to, if you have these issues, to email her constantly on even social media, because she wants to know what these problems are so she can figure out how to try to help us. So sorry to interrupt you, Commissioner, but I did meet with Senator Roxanne Prasad and her staff, and they did say they were very willing to advocate to see what they can do. So maybe we have to start writing to her and all our local state officials too, so they know what we're going through. Thank you.
Yes.
Thanks, everybody. I don't think we have any more public comment or questions in the room, so I'm sure the co-chairs will want to close us out, but I just want to say thank you, everybody, for your time. I feel like it's been a really collaborative year together, and I'm really looking forward to seeing the progress that we're able to make next year. So there's a lot of work that happens between the meetings. We don't just wait for the quarterly meetings to do it all. So there will be a lot of emails and meetings between now and our next meeting in March. So actually, if we can go to the next slide, we have next year's meetings up there. All right, so thank you everybody in the room, and a huge shout out to Rachel, who was our villain Josie. Thank you so much for managing our public comment, bringing everything up on the screen and making sure that our technology is working. And Amy for Cadman, who's going to be taking that role over.
Thank you, everyone, for attending today. Thank you, Commissioner, for spending the day with us. As Alexis just said, we will be busy. We don't have the action items to announce this moment, but you all will be getting an email very shortly with our notes and our next steps. So with that, best wishes for a happy holiday, however you celebrate, and take care. Safe travels, everyone.
Thank you, Kathy.
New York City says thank you and happy holidays to everyone.